Well, hopefully we think we have our internet working a little bit better now, and so we'll resume. We're admitting some.
Oh.
We see there. I'm looking again. It looks to me 1, 2, 1, 2, 6, 7, 8. So we do seem to have a quorum again, and we've been now joined by that. We recognize Rennie, even though he has a mask on. So Rennie, we heard about 2/3 of what you said in your previous presentation. So without redoing the entire thing, if you want to go back and hit a few of the highlights and then move into the bill, please do.
Yeah, Rennie, I think that you started going through where the money is gone, and you kind of had it broken down. If you could just start there.
Great. Mr. Chairman, do you just want to make sure also that you did receive the handout that we provided that is titled Wyoming's Administration of the Coronavirus Aid, Relief, and Economic Security Act Funds?
Yeah.
Yes, we did, and it was posted on the website. You can download it off the calendar. So yes, we've got access to that.
Mr. Chairman, I'm even hearing you now, so I think things are a lot smoother. Thank you very much. So I'm going to be providing quite a bit of detail that you can find on that same handout here as I move along. So thank you very much, Mr. Chairman. So again, the focus was saving lives and protecting livelihoods. Went through what was the hospital support program that provided nurses into hospitals and to long-term care facilities at the end of the year that we really felt like it made a huge difference. But that was part of a larger effort around that fortifying the healthcare system. And then within the protecting livelihood side, the outline was $419 million into those business relief programs. And that funding went to businesses that had 39,000 full-time employees, and that was 7,000 unique Wyoming businesses and nonprofits. So as I moved past that, I was ironically talking about the Connect Wyoming program, which I was commenting did not get new internet to the Capitol building, but what it did do was take internet at speeds 3 times the federal minimum out into 15 counties and 54 communities to provide broadband where it wasn't before that. And one item of note on that program is it even did employ some folks who were from the oil field industry that were out of work because of that downturn. And on that topic, Mr. Chairman, the Energy Rebound program was another success. The Business Council administered that program in collaboration with the Wyoming Oil and Gas Conservation Commission and other agencies, and that provided some direct targeted relief that helped get uncompleted oil and gas wells completed. It also helped to recomplete wells and plug some abandoned wells. And this again was a great effort to put people back to work. According to company estimates, those projects will provide more than 5,000 jobs in Wyoming and will produce over 150 million in oil and natural gas in the next year. In the education realm, Mr. Chairman, if you're still hearing me.
Yes, I am.
Great, thank you. I'll keep going. In education, feel like we made some great progress with some investment in childcare facilities to help those facilities deal with the COVID crisis. Provided resources into K-12, including a lot of technology that helped with distance learning and remote learning. And in the higher education space as well, got students back into the colleges and the university. And also we had scholarships for adults who were seeking accreditation and new skills here this past year. A couple other programs that we really do feel like made a difference involved those who are the least fortunate. Wyoming put $2.5 million into food security by supporting food banks And we also worked with county commissioners, and I'd really like to tip my cap to all of them, Mr. Chairman, because they worked on this program right around the Christmas time frame to get $12 million out to charities that were really impacted or their missions really supported or were impacted by COVID. So we do really feel like we were able to help the least fortunate right there at Christmas time at the end of the year. So again, thanks to the county commissioners for some quick work on that. And also thanks to several legislators who helped us with that program. Another area that I do really want to highlight, because this does also address something that's about to happen, and the CARES Act allows states to use dollars for the unemployment trust fund. And so this is a benefit to all of Wyoming, because by having that trust be more solvent, reduces the rates that employers pay, and that we were able to reduce the rate from where it could have gone up to in 2020. And the governor is planning to put another $39 million into that trust this week, because that's an eligible amount. And again, it's a benefit to the entire state, and that will affect rates in 2022 and beyond, and keep those rates from going up as much as they could, and that's for years to come. So that's a fairly good segue, Mr. Chairman, into giving you an update on the current status of where things are at. And again, this is addressed somewhat in the handout, but I'll pause again, and if there are any questions that kind of look back on how the funds were administered, I could take those questions, Mr. Chairman, or I can jump right in and give you the current status.
Thank you, Randy. Mr. Co-Chairman, would you have a question?
Yeah, thank you, Mr. Co-Chair. Rennie, on the unemployment trust fund, would it be possible for you to get us all of the specifics? In other words, how much they're paying, what benefit the first tranche and the second tranche of funds that the governor directed in that direction, how much it is, but more specifically, what the forecasted actual benefit is for each employer and their employees over time, so that we can monetize that in a way that we can describe it other than just saying it's a good thing. We need to just as much specifics so we can articulate that on the floor and publicly and to our, our constituents to understand fully, completely the full ramifications of that, all right?
Mr. Chairman.
Yeah, Rennie, and just to flesh that out, that idea, I think, that's an important idea. I did see probably 2 months ago an email from either your office or the governor's office. And so in particular, I think that centers around what would there would be a fund building assessment that would go out to every employer based upon, I think, the usage that occurred in 2020 and to some degree continues to occur. And so I think, that is very quantifiable. I think you've done that before. So please proceed to answer that question if you can, Rennie.
Great. Mr. Chairman, thank you. I'm believing my connection is good.
Representative Larson's got his hand up.
Well, we're going to let him answer. Is it about that question? We haven't let him answer the question yet. Representative Larson?
Yeah, it is. It's on the same topic, but I'll defer to you, Chairman Perkins.
Well, let's go ahead and let Reddy answer the question we've asked, and unless your question okay, well, go ahead, Rennie.
Mr. Chairman, I would just say, yes, we can definitely provide that same documentation to the entire JAC about what happened in 2020 with rates and with the investment into that trust with CARES Act, and then also what is forecasted with this additional $39 million that would go in now, and that does affect the 2022 rates.
Okay, thank you. Representative Larson.
Thank you, Chairman Perkins. And Rennie, on that unemployment, so in addition to the CARES Act, didn't we also get an infusion directly from the federal government on unemployment? And maybe I'm confused on that, but I thought we had some help there in addition to the CARES funds. And if you could, if that is the case, if you could just include that in your what that done, because we've certainly seen that impact. Thank you.
Rennie, and following up on that point, I thought unless I remember incorrectly, when we were back doing the special session, and we were talking about the use of these funds back in June, it did seem that there was an amount that there was amounts that were allocated directly to fund the unemployment benefits for the very reason that the hope that and the amounts, to the extent that there were funds, that they would not be charged against the employer and thereby also keep rates down. I think that's kind of what Representative Larson was referring to. Can you just, if you know, can you help us just kind of tell us how that worked out and just verify that these will be funds in addition to that?
Mr. Chairman, thank you. Yeah, so it is one of the fascinating parts of this is that to put our arms around the entire spectrum of funds that came in, both in the bill that passed in March of 2020, then the bill that passed in December of 2020, and now the pending legislation. But on that front, there was certainly a lot of money that went to the unemployment benefit to the unemployed individual. This was an investment because, as you're getting at, as unfortunately we had the huge spike in layoffs and people who were not able to work there for a period of time, that would have affected an employer's future rates. And there was not federal money that went into the trust fund, which there's a complicated formula that sets future rates for employers. And one part of that is the solvency of the state's trust fund. And so that's what we're trying to address, is that part of the equation. And that was not addressed by the federal government. And so there certainly rates are increasing in 2021 somewhat because of that increase in unemployment rates. And so the federal government, I believe, tried to do some things to blunt that, but could not do it. So this is what was done previously, and what we hope to do in the future are to take that side of the equation on to keep rates low.
Can you get in, or are you in?
Oh, yeah. Chairman Nicholas, your mic is on if you're talking on the phone. So, and Rennie, just again to follow up on that same issue, and then we'll go out. I think Senator Grew had his hand up, but please quantify for us. We actually have in a number of instances received questions or I've heard comments from our floors indicating that much of this CARES Act money never made it down to the people who were affected by it. The man and woman the workers in Wyoming. And I think that if you can help us when you provide those numbers to us, give us those numbers that went to provide those benefits. So in addition to providing the fact that the effect it'll have on the fund and on employers, I think it'll help if you can help us understand how much money was paid out to workers in Wyoming during 2020 in particular. I think that'll be help us too. Let's go to Senator Grew, and then we'll go to Representative Stiff.
Yeah, thank you, Mr. Chairman. To help me, I want to, so I can make that same case on the floor that the co-chair was talking about. If we can just start with the month before or at the start of last year, and then just walk through the year month by month about how the money flowed out of the UI fund, what money came into it, whether it was CARES Act money, and then what the infusion of the money the governor's talking about going in, and how that all flows through, and then how it did come out, going out the door to recipients. And I know there was that new program that got stood up for a sector of unemployed people that didn't used to qualify and the people that did. So just make sure that we see that all the way through, and then we can see, because I know going into it, that fund was very well, we're one of the more well-funded UI accounts in the nation. And I know we want to make sure that it stays that way all the way through. So that would really help me make that case. Thank you.
You got that, Rennie? You understand what he's asking? Okay, thank you. Representative Stiff.
Mr. Chairman, for Mr. McKay, I have a similar question. It relates to our special session legislation in May of 2020, when there was a provision that said that if unemployment benefits were paid out to employees who were laid off due to the coronavirus pandemic, that those amounts would not be charged as against the employer's account. I'm aware of at least one employer who had a layoff, the employee collected $5,000 in unemployment insurance, and then the employer was then charged, that full amount, which was a surprise to the employer, given that it was a coronavirus pandemic layoff. So my question, I guess, is where would I go, or do you have access to the information to show how much has been allocated to prevent these chargebacks to the employer?
Chairman.
Yeah, go ahead, Rennie.
So far in 2020, and the date when the trust is reviewed for its solvency, and to gain that part of the equation that then sets rates for the next year, is at the end of October. So using the session law, the federal law, with that being an allowed use of CARES Act, $38 million went in ahead of October. I could have my timing slightly off on that, but so for that, I believe it was 38 million is in the trust already. And the number is very similar, is the next allowable amount we could put in that is $39.7 million. And so that would be used with the CARES 2020 Act to offset that. But to your Representative Stith's point, I think we'd all hope that we could prevent any increases on COVID-related layoffs affecting the employer, since that in many ways was beyond the control of the employer. But it was not possible to do that completely given federal statute and other factors. But we have put in $38 million already, and this next 39.7 would be to affect rates in 2022.
But I think going back to Representative Stith's point, and maybe we need to check with Director Sessions or one of her deputies. But I remember that too, that one of the reasons, the first 38 that you're talking about, and we talked about that back during the special session, and we made the legislation there. Well, I thought one of the points is that we were not going to specifically charge COVID-related layoffs against the employer's experience rating, but we charged against the fund as a whole. And what Representative Stith is saying is that he's aware of at least one instance where a constituent was charged directly back, which will affect his experience rating directly, where we thought that, at least I was under the impression, along with I think Senator Stith and many others, that it would be charged against the fund of the whole, and it would come back as an experience rating or a fund building rate to everyone. But maybe I remember, and if Representative Stith and I remember wrong, we stand to be corrected. Is that correct, Senator Stith? That's you.
Mr. Chairman, that's my understanding, and so I was surprised at the result in that particular case.
And maybe Senator Guru has some information for us. Senator Guru.
Thank you, Mr. Chairman. Yes, I do believe if you talk to Director Sessions Cooley, I had a few of those for constituents who called me, and we got them all straightened out. It was just some errors that got, they took care of it. Her staff took care of it. So direct your constituent to give her a call, or you give her a call. She should be able to figure it out.
Okay. So maybe that one's resolved. Maybe you got off the hook on that one, Rennie. Other questions for Rennie at this point, for Mr. McKay? Seeing none, go ahead, Rennie. What else have you got for us?
Right, Mr. Chairman, I'll dive in now to the current status of where we are at today, or where we're at as of last Thursday. So again, on that handout, you can see that was as of February 17th, to give you an update. And so under those parameters of the state bills passed in May, $1.040 billion have been spent of the 1.25, and another 131 million is encumbered. And Ms. Legursky is here, and again, she can give you some updates on those dollars, those encumbered dollars, and what's pending within that. But generally speaking, within the encumbered section of that is all being processed. So it's encumbered and moving from encumbered to the invoices being paid. So beyond that, there's another $80 million that is not encumbered, And as I just talked about, 39.7 of that will go to the unemployment trust this week. 20 million is unallocated, and so that's available. And then the last $20 million is with specific programs and will either soon be encumbered or is paused while we wait to assess needs and wait for legislative action. So that's the summary of the 1.25 and where we stand today. So again, very close to all of it has been spent or encumbered, and that means will be spent soon.
Okay, thank you, Representative Larson.
Thank you, Chairman Perkins. Rennie, on the amount you have encumbered, the 131.7, is that is that those that have met and were finished up by the end of the year and just haven't been paid, or does that include some of those that drifted over, wasn't quite completed into the first of the year being completed, and you're going to take care of those as well?
Rennie?
It's a sorry, Mr. Chairman. It's a mix, but generally the majority of that, it was completed and approved prior to the December 30, 2020 deadline. So there are a few minor exceptions within that, but the vast majority of that we believe will just be paid at this point.
Follow up, Mr. Chairman.
Yes, go ahead, Representative.
Thank you. And so I'm hearing from a few around that were anticipated to be completed by the end of December, weren't able to, and there was some discussion about because they didn't get it done that they wouldn't be completely funded. Where are we at in that whole process and evaluating those programs? Are those going to, if you would, please?
And Rennie, I think that, you know, you've got a section in the bill that we haven't gotten to yet that deals with that. And that's also a place where we need to follow up with that very question. So we can either talk about that now, or when we get to the appropriate place in the bill, we can have that discussion, but we'll leave that to you, Rennie, if you have an answer now.
Mr. Chairman, thanks. As I look at that bill that's before you, it allows us to finish paying the invoices on those encumbered funds for projects and obligations completed before December 30th, and then also opens that door so that we can allow the state to complete the CARES Act projects under those programs created during the special session that were delayed slightly past that time frame. And so there's a slight mix, and some of it is the timing. But so I don't have a dollar figure for you today, especially where the hardest, where we're still waiting for more data is with the programs that were run through the SLIB, the State Loan and Investment Board. Across the other programs, we've got a pretty good handle on that of what was completed prior to December 30 and what is still pending and would need to be moved on. So Ms. Legursky could jump in and kind of take you through those encumbered dollars somewhat if you want to do that now, or just as I'm letting you know, as I look at this bill, I think we've got this pretty well taken care of to deal with what was approved prior to December 30, but what didn't get finished because of an unforeseen circumstance, and especially as we look at situations where COVID played a role in delaying the delivery of part of the product that needed to be used in the project.
Okay, thank you. And I'm sure when we get to that provision in the bill, I'm sure we'll have a little bit more discussion about that. So with that, Erica, do you have some further light to shed on this?
You know, Mr. Chairman, I can go through some of those if you would like, or if you had some specific questions, I'd be happy to answer those. I can give you kind of the buckets, if you will, of where that 131 million is sitting, if you'd like me to do that, just very high level.
Okay, go. Members, do you want to hear that? Bob, or excuse me, Mr. Co-Chair?
So what I would suggest is, and because this comes up on page 5 of the bill, but Erica, I think what we want is you probably have a breakdown of every application and how much was there and how much is out there. You've got to, so at the end of the day, I think we just like to see your list for everything and who you think is going to get it, both because the application was complete or because they were unable to finish on those two categories we're talking about. So because if we can see those, and if there are ways that we can tweak the language so we can open or close the door a little bit bigger or wider by this act, we would like the opportunity to do that, but we can't do that until we see what's out there.
Right. Yeah, and that's one of the things that we're seeing is there is a lot of competition for these unspent COVID dollars, the CARES Act dollars. We've seen there was an ag bill that at least went through Senate. I don't remember where it ended up on the House side. I think it went through the House, but we haven't had a conference committee on it yet. But I mean, I know that there's other bills out there that are seeking to use unallocated, unspent COVID dollars, and so we just need to get a good handle on that as we go through that, so that everybody understands that, and understanding that there's probably going to be more requests than there are dollars, and we just need to understand the priorities that we have and that the governor's office has as we move forward. I think, which gets to my co-chairman's point.
And to follow up on that, Mr. Co-Chair, Rennie and Eric, it's my understanding that with the FEMA dollars that will be coming in, that there may be $8 million additional dollars or more available that then will go back into the pie, if you will. And I want to make sure that this language in this bill is broad enough then for that to apply to new or existing applications or folks that are in the queue or maybe even if we fully allocate every application, that there could be new applications. If it's 20 million, then I think so. These are things we need to understand, and we need the language to be broad enough to cover that as well.
No, thank you, Senator or Representative Nicholas. Thank you. So with that, I think we're ready. Why don't we go ahead and go into the bill at this point, because we'll have this. I think that'll highlight some of the discussion that we're having now.
Mr. Chairman.
Yes, go ahead.
Just before you do that, because I think the co-chair brought up a point that's fairly important. So the FEMA, we have money now that the deadline has been extended. If we want to stretch the CARES Act money that we received in 2020, FEMA is certainly a tool for us to do that. And our analysis shows that could be a significant amount of money, but it will take months to process. We have to apply for a reimbursement to FEMA and then see if that's accepted and then receive the payment. But we believe, and Ms. Legursky can offer some more thoughts on this. We've talked with a consultant on this effort, and we believe that there could be $50 to $75 million that would come back in CARES Act if we do try to stretch this. So what the co-chairman brought up, I think, is an important point. As I read this bill, you are not able to put those dollars into new programs and approve new applications. And we believe that's the right approach, that we would be working with you, especially now that we see that there's likely to be another $1.9 trillion put into programs. And our analysis is that the bill that's pending before Congress now would bring Wyoming to the state directly about $736 million. Locals would get another close to $200 million directly. This time it would go directly to them without stopping at the state government. So with all of that happening, we believe that we should be planning because the parameters on that new money will change it as well. So we think that we would really like to spend some time working with you as legislators to evaluate and create a strategic plan that is going to maximize those dollars. So Co-Chairman Nicholas, to that question about the FEMA money or anything like that, we believe that this bill just wraps up the programs from 2020. So the only money we can pay out is to a project that was approved in 2020 before that deadline, but for some reason was delayed. And we view that it's in the best interest of the state to fund that project. And there are some nuances to your point of taking new applications. We would need to open that up widely, and then we would need to be dealing with different situations related to the programs about how to administer those new applications. So we think that would be a separate discussion from this bill.
So okay, let's go ahead and follow. Let's go ahead, Representative Stiff, and then we'll go to Representative Larson.
Mr. Chairman, for Mr. McKay, just to make sure I understood what you said, let's imagine you have a large dollar amount of FEMA reimbursement money. That's from the first CARES Act of 2020. So if it's not taken care of in this bill, what happens to that money? Does it just float in space? What happens to it?
Mr. Chairman?
Go ahead, Randy.
It would come back into the CRF fund that exists and would be there at that point. And we could not, because the special session law created new programs and also authorized the governor to create new programs to address the COVID pandemic. All of those programs expired on December 30, 2020. So we could not put that money into those programs without further legislative authorization. The only use for those dollars to spend would be on programs that already exist and where the governor believes that there has to be and would match the federal requirements for the dollars. So examples of that were the testing program. So if the FEMA dollars came back into the CRF and we needed to expand our testing or our vaccination program, we could use them on those. But generally speaking, what the approach would be with those dollars they would sit in that CRF account until we would work with all of you, and you would have to create and authorize new programs to spend those dollars on. So we could not spend them on any of the programs that were created in that special session law the way this bill is written, or without this, as of today, without further legislative action.
Okay, and okay, thank you. Wait, before we go to you, Mr. Co-Chairman, Representative Larson, did that answer your question, or did you have a separate question?
If I just need a little clarification, if I could, Mr. Chairman, from Rennie. So the reimbursement that we could get back from with using the FEMA dollars, we could get reimbursement for CARES money, the CARES 1 money that we had used, and free that up? And would that also apply to any general funds that perhaps might be out there that would qualify? Would it encompass both?
Randy?
Mr. Chairman, that's correct. And as I mentioned earlier in my testimony that might have broken up, one of the challenges we faced are changing guidance and changes from the federal government. So at some point, there was a 75-25 match. So we would still have to use 25% of the CARES 1 dollars on that. So we would only be reimbursed at the 75% rate. But at this point, there is 100% reimbursement on certain projects. And Ms. Legursky might be able to tell you the exact date about when that changed, but there is a date on that, and it may be more that's going forward. And the other factor on this is that this is only possible going back to the beginning of this fiscal year with the auditing requirements as we understand it from the state auditor's office. So there are some parameters around that FEMA money that don't allow us to open up, but we could also apply for new FEMA money going into the future, and especially with 100% reimbursement, we could use, if a program exists now, we could seek the approval on that going forward. One of the big programs that the FEMA dollars are going to nationally right now are enhanced vaccination sites and staffing and programs.
Okay, Mr. Co-Chairman.
So, Rennie, a couple things. One is, I think that we need to have a specific, one of my favorite things, short white paper on the whole FEMA situation, so we can articulate it and explain it and understand it. And with regards to that, and we might, in fact, we probably may even have you guys provide some type of a informal work group meeting where we can sit down and just walk through it and understand it better. And obviously, the sooner that we can do that, the better. And then the next question is, you said you had a consultant who evaluated this for you. The possibilities of this year, last year, and the 75-25 plus the 100%. What we need to understand is there anything that we need to do to stand this thing up as literally as fast as possible? You hiring full-time consultants, hiring somebody to assist your office, and frankly, so we can kind of monitor it as well, to make sure that we move forward on this absolutely as quickly as we can to just get every dollar out of this that we possibly can. So that just makes sense to me.
Thank you, Chairman Nicholas. So did you get that, Rennie? Okay, thank you. Are there any other questions before we start down to the bill? Senator Steinmetz.
Thank you, Mr. Chairman. I just have a broader question, and I'm wondering what it looks like to begin working our way out of this situation, how much longer we are expecting the health orders to remain in effect, specifically the mask mandate, and how those orders affect whether we receive funding or not, if there's an interplay there as well. Just moving forward as we work our way through this, and we want to absolutely support our businesses and our workers and all of our state agencies as much as we possibly can. But what is the plan to, then kind of work our way through on the other end? Thank you, Mr. Chairman.
Thank you, Senator Steinmetz. Rennie?
Mr. Chairman, thank you. Very important question, and as it related to orders at this point, they're reviewed in every 2 weeks at this point. So a review is happening right now about what the next orders would look like. And as you've seen, they've progressively been loosening over time. There also continues to be the ability for a county to get variances. So I think we've got 3 counties right now that have no orders except related to schools. So we are progressing in the right direction in terms of what's going on with our hospitals, with cases, with the percent positive of tests. So some very good progress is being made. And Mr. Chairman, as I mentioned, where we look at the next CARES Act, right now, there is not a tie to any emergency order or anything like that to those dollars. But they're obviously, there's a big chunk of the dollars nationally and within the state where they do want the state to be looking at responding to COVID to keep people safe. But that doesn't necessarily mean anything to do with orders. So we could be running programs as we move ahead. But as I said, we want to have a strategic plan on those dollars, and we also are working constantly to review what's happening on the ground and to plan so that we can continue to protect livelihoods, as I said was one of the main focuses of the governor throughout this year. And so I guess I'd say we'll really want to work with you so we have a plan in place, not just for the CARES 2.0, this next round of funding. And we won't have, that bill has not passed. And then there's a lag between the bill passing and guidance coming out, and also a lag, it says right now 60 days. So there's a lag after it passes, before the money arrives and before the guidance comes out about how to spend it. So I think we should really be talking about what that looks like between the executive and the legislative branch on how we want to have this next year go. And so look forward to those conversations. I know part of that's happening and has been happening over the last several months as we create programs under the 1.0 federal dollars.
Thank you. Any Senator Steinmetz, any follow-up, or are you okay? Okay, thank you. So if there's not any more questions, are we ready to go through the bill then? So who's going to take through the bill? Rennie, are you going to continue this effort of taking through the bill, or are we going to go to somebody else?
Mr. Chairman, Ms. Solai, another senior advisor to the governor, could brief you on the eviction portion of the bill if you want, or and give you an introduction both to what that federal program is, how it differed from what was run in 2020, and also our current status after the governor signed an executive order to start work to get that planning going for that program. So sorry again to ask, but if you want an overview to start with, Ms. Solai is prepared, and she's also provided some handout materials for you that relate. We think you've got a strong bill to go with, so we can provide you the overview and get out of your way.
Okay, why don't we can go ahead and do that. You said, is that Emily that's going to do that? Okay, go ahead, Emily.
Good morning, Mr. Chairman, members of the committee. As Rennie said, my name is Emily Solai. I'm special counsel to the governor. I'm also a senior policy advisor. And I'll be speaking about the Federal Emergency Rental Assistance Program, which, as Rennie said, is covered in the bill before the committee today, just like the remaining CARES Act dollars. So like the CARES Act, the Federal Emergency Rental Assistance Program does provide a minimum payout to each state. That is what Wyoming received, and that is $200 million. The purpose of this funding and the sole use of this funding for each state is to provide rental assistance and assistance with utility costs to people that are income eligible in the state. And so we have provided 2 handouts to the committee about this program. The first that I'll cover relates to the level of need across the state. But at this stage, let me just pause. Mr. Chairman, can you hear me okay? Is our connection still working?
Yeah, we can hear you. There's a little bit of an echo in there, but I think you might lean just a little bit closer to your mic. I think that'll solve it.
Okay, great. Thank you, Mr. Chairman.
That's better.
Perfect. So we were specifically asked by legislative leadership to touch on the level of need in the state, which is what we've done in this first handout. Unfortunately, because there is not a state program that assists with rental assistance specifically or housing assistance, we don't have a centralized database to look to pull numbers on the number of tenants in the state, their income levels, things like that. So what we've done instead in order to capture need for this program is to reach out to the service providers that are really providing a safety net to families now that are risking homelessness and that are continuing to be impacted by COVID and its economic harms. And so the handout that you have in front of you, the first page and a half of the second page provides some kind of hard data points that we were able to collect from those service providers, from churches, from landlords. And the remainder of the handout is some anecdotal evidence. So how nonprofits have described the level of need that they're seeing in their communities and from their specific clients. And I would say there's 2 key things to know from what we've found. First, families in Wyoming continue to be at risk of losing their housing and losing their stability because of that. And the second is that landlords are experiencing their debt piling up because of unpaid bills. So specifically what we found is that the need across Wyoming for housing and utility assistance has increased every month since the pandemic began in March. In some areas of the state, requests for this type of assistance have increased 800% over 2019. On a statewide basis, 211 has seen these requests increase by 285% since 2019. And so you can see from that graph at the bottom of the handout, in 2019, it's relatively steady, the number of requests that come into 211 for rent and for utility assistance. But beginning in March of 2020, when the pandemic began, every month those requests have increased to 211. That
continued to be the case even when the statewide program went into effect, which was in April, and it continues to be the case today. Of course, there is no state rental assistance program now, and so it makes sense that those requests continue to come in now. What we've also found is that many people who are employed but who have faced reduced hours, a reduction in wages, need rental assistance now as well. So it's not just the unemployed in our state, it's also people who are employed, but because of economic impacts of COVID, are not receiving the same level of payment that they did in 2019, and so they're struggling with their rent. We heard specifically from a nonprofit in Teton County that 77% of their recipients for rental assistance, so this is not the state program, this is a private nonprofit program, 77% of those recipients were employed, but still could not afford their housing. What we've also learned is that the state program that was created in the special session law for housing assistance did help some people. It provided critical assistance. It provided a safety net, but it did not capture everybody that was in need. And I'm prepared today, Mr. Chairman, to go into the differences at a detailed level between the federal legislation that created this new program and the state legislation that governed the state program. But I think it suffices to say at this stage that we believe the federal program will provide more relief to more people. We think it provides broader relief than we had in the state program. And finally, what we found is that both landlords and utility companies will benefit from this program and really need this program in place. And so I think as the committee is aware, there's been an eviction moratorium in place since September nationwide. That's from the CDC. And what that's done is it's really removed the relief that is typically available to landlords if rent is not paid. And of course, that is eviction. And so landlords are in this unsustainable place of not receiving rent, in some cases not being able to evict anyway. They still owe mortgages on their properties, but they're not receiving that income to offset those costs. And so landlords are really in need of this program in addition to the families that risk homelessness. We did receive a survey. The Cheyenne Landlord Association and 211 helped us out with this. There were about 72 landlord respondents to that survey. So it captures a very small percentage, I would say, of actual landlord numbers in the state. But those 72 respondents reported being owed about $500,000 in past due rent and past due utilities since March. So a huge expenditure, especially for our smaller landlords to take on in the state. As I said earlier, this program does not just cover rent, it also covers utility expenditures. And utility companies have also reported having bills stacking up that tenants are unable to pay. One utility company reported being owed at this point $1.6 million from tenants since last March. So this program really achieves two goals by design. One, it provides that safety net for families that are continuing to struggle. But two, it makes landlords whole, it makes utility companies whole, which of course helps our economy to recover as well. So I think that covers the level of need handout. The second handout, Mr. Chairman, that we have is the federal requirements. Would you like me to move on to that or pause for questions on need?
Let's go ahead and take a few questions. Senator Guru, I saw your hand up. Do you have a question? And then we'll go to Co-Chairman Nicholas.
Thank you, Mr. Chairman. Ms. Sol, in the bill itself, on line 2 or page 2, line 16, it says other entities can help with the Department of Family Services to administer this program. What's envisioned there? And I'm specifically talking about, are some of those local NGOs anticipated to be able to help with this program? Is that what you're looking at, or what exactly does entities mean?
Emily?
Mr. Chairman, Senator Guru, that's a great question, and I will cover later in my presentation kind of the stage of setup that we're in right now. But specifically with that section, the Department of Family Services is currently working with a coalition of agencies to roll this program out. So that includes agencies like WCDA, and unemployment. And we envision that those agencies will continue to assist in administering these funds when implementation actually begins. As far as your second question about whether nonprofit entities might be able to be included in this process, we think so right now, but we are waiting for additional federal guidance on that point. The federal legislation that created this program does allow for funding to be used for case management supports. And when we look at that language, what we're thinking and what we're hoping is that case management supports can allow for DFS to issue grants to nonprofit entities to help folks fill out those applications.
And if I can follow up, Mr. Chairman?
Please do.
And as you get into the second handout, I'll just kind of pre-ask so you can kind of highlight it. The WCDA program really was tough on people actually getting money. It did not get money out the door. And you stated in talking about in the first part of your narrative there, entitled the first handout, this program is different and it's going to be easier to get money to landlords and for tenants to be able to get relief on rent and get relief on utilities. And I agree. I know our public utilities holding a lot of money right now. We're holding a lot of bills in abeyance. So there's a backlog all across the state. As you go through that, point out to me as you go through it, what are the things that are in this program that are different than what was in the previous program that are going to make that easier? If you could just highlight them as you go through, that'd be great. Thank you.
Thank you. Chairman Nicholas. Mr. Co-Chair, did you have a question?
Yeah. So, and for Emily and or Erica or whomever, first of all, my first question is, it looks to me like we probably could use some of these funds to backfill the COVID dollars from the bill that we passed in May, so that we can free up more COVID dollars, because we provided at least some of those recipients would qualify for these benefits. Is that a fair characterization?
Emily or Rennie, whoever?
Mr. Chairman, Co-Chair Nicholas, I think that's a great question. I think we would need to look more closely at that. The federal legislation does specify that this new program we cannot use its funding to pay for rent that has already been covered by other federal programs. I'd have to look closer at that to see if the CARES Act program that the state stood up would also be prohibited from us using these dollars now to kind of backfill. So I think we'd have to look closer at that, but I think that's a great question.
And then my next question.
So before you go, Chairman, so Emily, can you let us know, when you do your research, let us know what the answer to that question is as far as you can tell, if you would, please, okay?
Mr. Chairman, absolutely.
Thank you, Mr. Co-Chairman Nicholas.
Yeah, so next, in terms of standing up this program, and when in reading through the language of the act, it appears that we've got to do all this by essentially December of this year. So, and we're still waiting on more Treasury guidelines, and so that's going to put us 2 or 3 months from now before we can start digging out the dollars. And so but I think it has a percentage of the 200 million can be used for, like you said, case management plus just the government costs and operations of doing it. And so it would appear to me that in order to maximize the ability to use all of these funds, that we're going to have to go into every community and have either the city or the county go out and act as essentially your boots on the ground. And we may have to hire 5 or 10 people that actually can go out and knock on doors in order to effectuate this and provide the benefits to everyone that's out there. And we probably need some type of a public media way that we go out to every community and we get on the radios and we get on local TV in order to outline the guidelines and just make sure that we do this, because otherwise we're just going to take the money and and give it back. And my understanding is there may be additional dollars after this if we can expend as much as possible under certain conditions. And so, given all of that, I just, other than just saying, okay, executive branch, off you go and take care of this. Where are you in setting up? It appears to me this will be a massive undertaking. It's going to take a lot of manpower, and I can't see it happening with just 2 or 3 folks in the governor's office and the 2 or 3 people in DFS to implement this thing. It's one of those things that we've got to heave ho and hire it whoever we need and whenever we need to get this implemented. So just your thoughts on that, the whole concept, Emily.
Well, and if I can just interject on that, because it goes back to what Senator Grew was talking about a minute ago. That's one of the great benefits. We have NGOs that are embedded throughout these communities. We have, a number of our municipalities have various forms of housing authorities. So there is already a significant network that exists throughout all of our communities. And somehow, some way, we need to Chairman Nicholas's point, we need to take advantage of that, because again, you go back, and if we go about the agencies don't have that reach and that breadth and that network in a community already. And there are significant networks already available if we can somehow take advantage of those to make sure this relief is out there to those who need it and may not even know about it, but would otherwise qualify. Representative Larson.
So Emily, I guess to tag on to that, my question was, is that why you guys selected Department of Family Services? Because they really have a presence in most of these communities and really work largely with these populations that are in temporary, in rented housing. They work with the TANF, they work with the power, they work with all that, and they work with NGOs to some degree. So I'm guessing that you'll help us understand, but it would be my assumption, and maybe you could correct that, that's why we shifted from WCDA over to Family Services, is for a broader reach.
Yeah, Mr. Chairman.
Go ahead, Emily.
So Mr. Chairman, Representative Larson, Co-Chair Nicholas, I think those are all really good points. And that is what Representative Larson described is exactly the case. So I will note right off the bat that the governor did issue an executive order earlier this month, providing the Department of Family Services with authorities to start standing this program up. So that authority ends at actually administering funds out to eligible households. We understand that the legislature would like to consider a bill for that purpose. But as far as creating the processes and getting the administrative pieces set up so that once legislation is passed, this funding can go out the door right away, that is something that the Department of Family Services is already working on. One of the reasons that DFS, actually the key reason that DFS was selected through that executive order is the fact that, as Representative Larson noted, they already do this work. So they already administer federal benefits programs that have very specific eligibility requirements, very specific documentation requirements, which is exactly what this program does. And so DFS was a good connection for that reason, in addition to the fact that they have offices across the state. It's been brought up several times that nonprofits have a network already. They're already providing these services to people in Wyoming. They've been providing the safety net to people in Wyoming really since March. And we are reaching out to those networks. We would like to incorporate them into this program. Again, we are hopeful that that piece of legislation that allows these dollars to be used for case management supports will allow us to provide grants to those organizations to help people fill out these applications. We've gotten some mixed messaging from the feds on whether or not that will be the case. But what we do know that additional federal guidance is forthcoming. And so we're going to be looking really closely at that. And if we can provide this funding to nonprofits, that is exactly what we want to do. I will note that it's not just a few people in our office or in DFS that are working on the structure of this program right now. There are a number of agencies and state entities involved. So DFS has created a steering committee with the agencies that sort of provide these kinds of services already, but also the agencies that were deeply involved in CARES Act distributions and learned important lessons from those distributions that can now be used for this program. So those agencies include Workforce Services, which is a lead in the steering committee, as well as WCDA, the State Auditor's Office, ETS, Public Service Commission, Business Council, and our office. And one of the primary reasons, Co-Chair Nicholas, that Business Council is a part of this coalition is because of their communication strategy in the Business Relief Grant Program. DFS would like to implement something very similar for this program, including by reaching out to contractors to make sure that the message reaches everybody across the state. We want the messaging to reach tenants, but we also want to make sure that landlords understand that this program is out there, what the eligibility requirements are, and specifically what the application process is.
And Emily, I think that's a very important point, because landlords will not be in the network for the most part. The landlords who, I think the mortgage companies are going to be able to, they've got their lawyers and their staff, and I think for the most part, mortgage holders can figure this out. But landlords, which run from significant corporations to many investor mom pop type investors that will not, I talked to a number of constituents who had no idea about the rental assistance programs that were out there before. And so again, as we talk about that, how we get to those folks are the ones that I think are going to have the hardest time knowing about how to apply and how about going about doing it, because being in a federal program and receiving federal assistance is going to be new to them. Representative Walters.
Thank you, Mr. Chairman. Ms. Solai, following really on what Chairman Perkins was just discussing, and that is on the landlord side of this. The program going through DFS and Workforce Services really focuses on those clientele that are already in your system. However, the payments, reading your next handout, the payments go directly to the utility company or the landlord. And so where will the landlord be able to reach out to your office or somebody to initiate a process? And I think it's 10% of all the funds can be used for administration. So can a landlord take these applications around to all their tenants, have them signed, and return them and receive an administrative fee for doing that effort and get paid to try and expedite the process? Because what I see is a disconnect. These tenants read the headline that they can't be evicted, and so they have really no motivation to fill out any paperwork because they have read a headline somewhere that says they can't be evicted. And so yet the landlord is still stuck paying their mortgage on the property, paying the utility bills. And so to me, this program is as vital to the landlord, to keep the landlord solvent as it is to keep the tenant in their dwelling. And so I guess I'm probably more concerned about the landlord, because if the landlord loses the property, then the tenant won't have a place to live. And then the follow up on that, which expands, is they can essentially have the program for 15 months. And so if they go to arrears of March or April of 2020, really this program only extends through about June or July of this year to incorporate all 15 months. And so how do we get it rolled out and going and covering people and really only get 15 months and end up in June or July and it expires? So several questions there, but mainly concerned with the tenant or the landlord side of it and where they apply and where they can get things done.
Go ahead, Emily.
Thank you, Chairman. Thank you, Representative Walters. Yes, the landlord, again, one of the primary purposes of this program, in addition to providing safe housing to tenants, is to make sure that landlords are made whole, especially because of that moratorium that was put in place in September. And so Department of Family Services is very aware of that, and they're aware that their network primarily is going to be the tenants, not the landlord. So again, that is why the Business Council is included in the steering committee for this program, and is why any kind of public communication strategy, marketing strategy is not just going to be geared toward tenants and nonprofits, although they will be a part of it. It will also specifically be geared toward landlords. we have, in addition to reaching out to nonprofits and letting them know that we're working on this and gathering evidence of need from them, we've also reached out to the Cheyenne Landlord Association, which despite its name is actually kind of expanding out on a statewide basis to provide supports to landlords across the state. And so they've been a close partner in providing data to us, and they will be a close partner to us, I hope, if they're willing to do so, to make sure that landlords are aware of this program and how to apply. As you noted, Representative Walters, landlords will be able to submit applications under this program. That's actually one key difference between this and the state program that was set up. And landlords, they'll need to get signatures from their tenants, so they won't be able to just submit an application on their tenant's behalf without consent from the tenants. But they can be involved in the application process. And Department of Family Services, again, is very aware of that and wants to make this program as accessible as possible, which means not just making sure that access is broad across the state for tenants, but also for landlords themselves to get this relief out the door. Regarding your question on the 15 months, I mean, you're exactly right. So 15 months is the maximum under the federal legislation, and arrears must be paid first before prospective rent can be covered. 12 months is the maximum for arrears. So to the extent there is an applicant, whether it's a landlord or a tenant, seeking relief under this program, and they note that rent has not been paid since March, then it would be the case that June would be the final month that relief under this specific program could go out, because they've got the 12 months of arrears, which would be the maximum, and then the 3 months of prospective rent moving forward. So that is capped within this program. And unfortunately, that's nothing that the state can change. That is specifically within the federal legislation. So unless we see changes to that legislation, that is the maximum. Does that answer your questions, Representative?
Representative Walters, you?
Yes, thank you.
Okay.
Thank you. I no follow-up.
Thank you. Any other questions? So Emily, I think, I think you got to finish your presentation of that second handout.
Yeah, Chairman, if I could, and maybe before we even get to the second handout, I do want to address specifically the question about differences between this program and the state legislation.
Okay.
Since that question was specifically posed. So we do, as I said, believe that the federal requirements under this program are broader and will capture a wider group of beneficiaries than the state program did. And so to note some of those differences, I mean, there are some differences where this program is actually more restrictive, I would say, than the state program was. And this addresses one of your points, Chairman Perkins, actually. The main reason for that is that the federal program is not available to cover mortgages. So these funds cannot be used to pay folks that own their homes, including their utility assistance. It's only open for tenants and their rental assistance and their utility costs. So that is one way that this program is significantly more restrictive than the state program was. But for those tenants that would qualify for this program, the application process, we believe, will be easier. And we do believe that more of those tenants will qualify for a few reasons. So one reason is that the state program by statute conditioned eligibility exclusively on lost income related to COVID, whereas this federal program also allows for relief where a household can show that they had either lost income or significant expenditures related to COVID, or more broadly, any financial burden related to COVID. So in addition to lost income, there are a couple other economic features that can be proven up by families to qualify for this federal program, which was not the case for the state program. The state program also conditioned payments on the tenant continuing to occupy the same unit, which my understanding is that created some difficulties, especially with landlords who perhaps did not want their tenants to remain in that unit for reasons that were different from just their inability to pay. This federal program specifically does allow arrearages to be paid, even if the current tenant lives in a unit different from where those arrearages are going. So if the tenant has moved in the course of the last 12 months, arrearages can still be paid both to the former landlord and to the current landlord, which I think will be really important in making sure that the landlords participate in this application process as well. It makes it friendlier to them. Another significant difference is that the state program required a copay from families. This program does not require any copay. The state program also capped monthly benefits amounts, which this program does not. It does have a 15-month income or a 15-month benefit cap. That's the maximum amount, but each monthly benefit is not capped at any specific amount under this program. The 15 months is also a longer period than the state program. The state program ran from April to December. So 15 months is longer than that. Get more dollars out the door that way. For landlords, as I said earlier, could only participate in the state program if they could show that they had a loss of 25% of their rental income. That was a difficult bar for landlords to clear. This federal program, as long as they get their tenant signature, does allow for landlords to submit applications for relief into this program. And finally, as has been mentioned a few times, this program does not just cover rent, it also covers utility assistance. Importantly, it also covers administrative costs. So 10% is what can be used of the funds that was given to the state, either for administrative expenditures by the state or for case management services, which again is sort of a gray area right now, but we're hoping that can be used for nonprofit supports. This program also will allow for other housing assistance, is how it's worded in the statute. We've been notified that Treasury will provide guidance specifically on what is other housing assistance, but depending on how broad that category is, that provides some things that would not have been provided by the state legislation itself. So those are some major differences between the state program and the federal program. The federal program does have very specific requirements. So this is a major difference from the CARES Act, which, unlike the CARES Act, the state for this federal emergency rental assistance program does not get to choose how it spends these funds. The state's only option is to spend the funds to help eligible tenants pay their rent and their utility expenses, and then some of those other yet undefined categories. So the key takeaway was
Emily?
Yeah.
I think this, again, you come back to Representative Walter's questions. We keep talking about eligible rent assistance, and I get that. But the payments get made to the landlords, and landlords are how are landlords supposed to go out and determine qualifying income and all these other factors? How is that going to work if the still struggling to see how this is as in a practical matter works, because there's not a whole lot of incentive for a tenant to apply other than to help live up to their obligations, and to the extent that rent's paid to the landlord, they're excused from their what's accruing against them. But again, how's the landlord come back and comply with these various requirements regardless of which program they're in?
Chairman Perkins, that's a good question. And under the legislation, administration of this program will have to be on a case-by-case basis per household. So although landlords can participate in the application process, and we want to make sure that they understand how to do so, they can't do it without their tenants' consent. So their tenants will have to provide a signature. And as you're noting, the tenants will have to provide information as well. There will be information from both parties that the program will require.
This is going to be a train wreck, but go ahead. Go ahead.
Thank you, Mr. Co-Chair.
Mr. Co-Chairman.
So, Emily, it's kind of fascinating to hear you, and listen to what these requirements are. But if it's any financial burden, I think that means any person that didn't have childcare services because of the COVID. It's any person that had to help homeschool because the schools were closed, which added additional burden, and any additional cost associated to any one of those, or people that had to stay home with their children because the children were doing online learning because they couldn't go to school. All those are financial burdens, and so even the lack of ability to travel can be a financial burden, and lack of services that are available in the community because of COVID. All those things I think fit what you just described. And so which means is the rules that you put together and the application that you put together is going to be determinative of who qualifies or who isn't, because people They will not be sophisticated enough to understand what I just said. And so what the other thing we're going to need is a little army of volunteers of these NGOs and communities, literally to go knocking on the doors in the neighborhoods where all the rentals are, to get this thing going. And so that goes back to our, this. I agree with the coach here. It's going to be an absolute nightmare for this thing to implement. On the other hand, we just got to do it. We got to kind of go all hands on deck and start running versus walking. So anything we can do to help that, or help the DFS to move this thing along, just tell us how we can help. And so I'll start going down to the South Cheyenne and knocking on doors. I mean, if we need to do it, we need to do it.
Chairman Perkins.
Go ahead.
And Co-Chair Nicholas, yeah, I think both of those points are spot on. I will point out that this is exactly why the governor issued that executive order to get administrative processes set up right now, so that that process doesn't start after legislation. We've already got the procedures in place to make sure that everybody knows about this program, and that the application is not just as accessible as possible, but to your point, Co-Chairman Nicholas, is as easy as possible for people to understand how to qualify and to get through. Because we did hear that the WCDA application was a burden for the tenants that qualified. Regarding your comment, Co-Chair Nicholas, about an army of volunteers, our hope is that we won't use volunteers, but that these administrative expenditures and the case management portion of this budget will be used to let nonprofits have the staffing to do exactly that, and to have the temporary staffing either within DFS or Workforce Services or WCDA or some combination of all of those entities, to again get the word out and help walk people through the application so that they're not left at home wondering what financial burden means, but that they know, they can express their circumstances, and then the state can decide whether or not they qualify. Because Co-Chair Nicholas, I think you're spot on that each of those items that you listed are a financial burden for families and could qualify them for this program.
Senator Representative Kinner.
Thank you, Mr. Chairman. Mr. Chairman, it is my understanding that we do have folks waiting to give public comment. So when we get to that, and to speak to possible help with boots on the ground, just thought I would mention that as it might be appropriate right here.
I know. Thank you for that. I mean, at some point we actually have to go through the bill too. So then we'll take public comments. So we really do need to wrap up the presentation and get to the bill. So, so continue on. We don't want to miss any of the important information you have for us. But we because of various reasons we're already running behind schedule. So go ahead, Emily. Please finish up.
Chairman Perkins, thank you. I will be very quick. You have in your handout the detailed federal requirements for this program. What I would like to point out is that this is pretty different from the CARES Act. We've got to follow these specific federal requirements. We can't deviate from those at all. There is one way in which this bill is similar to the CARES Act, and that is that it is subject to guidance that will be issued by the Department of Treasury. An important lesson that we learned from the CARES Act is that guidance can change without any notice, and that agencies administering these types of funding need to be able to pivot quickly to acknowledge those changes without a lapse in services. And so, Co-Chair Nicholas, to your point of what can be done to help DFS with this program, it would be to allow within the bill that kind of flexibility, because we anticipate that guidance from Department of Treasury will change for this program, just like it did for the CARES Act. And in fact, that's already happening. We received guidance on January 19th, and we've already received notice from Treasury that guidance is being revised currently. So as flexible as the bill can be in providing DFS with authorities to administer this program, that will help DFS change on a moment's notice to make sure that the funding keeps getting out the door. And we do believe that the bill currently provides that kind of flexibility.
Okay, thank you. Are there any other questions? We really do need to get to the bill, folks. If there's any other questions or any other specific comments, Rennie? No? Okay. So who's going to take us through the bill then? Director Olbrich, you came on. Is that your job?
Mr. Chairman, it is to begin with, for sure. I think this discussion, though, is going to exceed the amount of time I have today. I have to go give a training at 11 o'clock. So, but I'll walk through the bill, and then Dave Groover can answer any questions if I have to leave before committee discussion is done.
Okay, thank you. Let's go ahead and get started then.
Okay, Mr. Chairman, page 1 is the bill title. As Rennie and Emily have indicated, the bill covers emergency expenditure of federal funds related to the COVID-19 pandemic, both the rental relief program and the remainder of the CARES Act funds. On page 2, Mr. Chairman, section 1, this deals with the receipt of, sorry, Mr. Chairman, this is actually allowing DFS to stand up the Federal Emergency Rental Assistance Program. And as has been pointed out here, this section authorizes the department to designate other state agencies or entities, administrative functions under the program, allows them to issue grants under the program for the purpose of the provision of case management and other housing support as permitted by federal law, and also exempts this program from the competitive bidding and other procurement requirements of Chapter 6, Title 16 of the Wyoming statute. This program expires 90 days after the latter of the expiration of the program under relevant federal law or any extension granted for the use of the funds by Treasury guidance. Section 2 on page 3, starting on line 10, Mr. Chairman, is dealing with the CARES Act applications that had been approved prior to the expiration of those programs that you enacted in the May special session. So those applications that were approved but weren't funded or couldn't be completely undertaken and finished prior to the expiration of the programs on December 30th, 2020. So this allows those applications to be completed, provides discretion to the authorizing state entity on whether it's still in the best interest of the state to fund those applications. And then Mr. Chairman states that funds shall be expended on projects, grants, or procurements under those requirements as they were originally contained in whatever the enabling legislation was during the 2020 special session. Section 3 on page 4, Mr. Chairman, line 14, is the appropriation of whatever federal funds we get for the Emergency Rental Assistance Program to DFS. And Mr. Chairman, those funds revert as provided by law upon the expiration of the latter of the relevant federal law or reallocation by the Secretary of the United States Department of Treasury or any extension granted by the Treasury Department. Mr. Chairman, page 5, line 9B is the reappropriation of CARES Act funds in an amount not to exceed $20 million for those applications as I described and as Rennie talked about, Erica, under section 2 of this act. And Mr. Chairman, those funds revert on December 31st, 2021. Section 4, page 6 is rule making authority for any agency for any program. And section 5 is the effective immediate date. Mr. Chairman,
That's it, short and sweet, huh? So let's go ahead and start with some questions. Representative Larson.
Thank you, Matt. A couple of them, if I may, Mr. Chairman. On page 4, when you talk about the administering agency or entity being able to deny payment of funds, is that in full or in part? Is that left to discretion, or is there a, if you could answer that, could that be paid for all that was done and non-payment for the left leftover part, or how does that work? That seems unclear. And then the program is created on back on page 3, where the program is created for 90 days. If the program's expired and there's applications in the process, can the payment of those applications be done past the expiration date? Or there's a couple of the questions that I had.
Go ahead, Matt.
Mr. Chairman, Representative Larson, last question first. That's why we included that 90-day cushion, is so that after the expiration, those sort of programs that were still being, or applications that were still being considered, could be completed. And Mr. Chairman, as to the discretion under the remaining CARES Act program of what portion of the application that could be approved, Mr. Chairman, my reading of this language is that that discretion would be inherent within the agency to decide what portion to still fund. But Mr. Chairman, if the committee wanted to consider additional language to specify that, we'd come up with something.
Okay, thank you. Other questions? Co-Chairman Nicholas?
I just want to follow up on that. When I read the 90 days, that's talking about the expiration after the later of the expiration of the program or under relevant federal law. So that's not talking about applications that were submitted but may have been incomplete or that were under consideration and hadn't been approved. So, Matt, where am I mixed up on that? Or?
Mr. Chairman, so that's the actual end of the entire program itself. So, and what our intent was, I think, in discussing this with Rennie and the language that Emily came up with, was instead of the hard stop like we had on CARES of just in our special session law, when those programs ended on the exact date that our CARES Act funding ended, that to provide ourselves with that 90-day cushion just for those exact situations that you talked about. That if after the expiration of the program, if for some reason there was a hiccup with the actual distribution of the funds or work that needed to be completed, but we could continue that after under the Treasury guidance, that was what the 90-day provision was for. Also, I'd point out, Mr. Chairman, that puts us back into the 2022 special budget session as well for any future legislation that's needed on the program.
Thank you. Co-Chairman Nicholas, any follow-up? You're still on mute.
My question is, I mean, how many applications were being considered but were denied or just couldn't be completed prior to December 30 of 2020? And are there any such applications that either you or that maybe the legislature would want to say, these certain applications in this certain class can be reopened and reconsidered and reevaluated if funds are available?
So, and actually, if I can just expand on that question, it seems to me that there's really kind of maybe 3 buckets of grants or awards or other expenditures we're talking about. We're talking about grants that were awarded but weren't able to be expended for various COVID-related reasons or delays. That's kind of bucket 1. And I think there's bucket 2 that Chairman Nicholas is talking about, which is grants that were in the process of being considered and just couldn't be considered because you just flat out ran out of time under the old COVID Act. December 30th came rolling along, and so they were caught betwixt and between. And that's a little bit different because they weren't quite as far along in the process as the first group. And then I think the third group is those that were expended, but that just hadn't been, there may have been expenditures made that may have been incurred, but they just weren't reimbursed or they couldn't get their reimbursements in on time. And I think we're trying to make sure or figure out 2 things. One is making sure that all those buckets are covered under the language of this bill. And then the other question that I think goes directly to Bob is, how do we, as we do that, it's incredibly broad discretion at the governor's office, which I don't know that we necessarily have a problem with, but we would like to know the kind of the population of grants and folks that are out there, particularly in buckets 1 or 2, that may be affected by this, because they may be permitted or they may be denied in accordance with the governor. And we at least like to know kind of what some of those are, to see if there's anything else we need to cover, or if there's any other action we should take. So anyway, I think that is what we're trying to figure out. And so how do we, 1, is this language broad enough? And 2, we'll need some specific information from the governor's office. So Matt, you first. Does this language cover all 3 of those buckets?
Mr. Chairman, I actually don't think it does cover all 3 of those buckets. I think it purposely doesn't cover all 3 of those buckets. So I'll let Rennie expand on this a little bit, but I think the point was that there's a known universe of these applications that were approved, but because of timing issues or being able to find a contractor to fulfill the work before that December 30th deadline, the work could not be completed. And so the intent was to finish out those approved applications that could not get the work done, but are still within the best interest of the state. And I would also say, to your point and to Chairman Nicholas's point, there certainly could be an opportunity for the legislature to weigh in the future on other potential use of the CARES Act funds if we get reimbursement from FEMA on those future funds. As of this date, we don't know what that number may be. Until we do, it seems premature to try to put that into legislation. So I think with that, I'd hand it over to Rennie.
Mr. Chairman.
Yes, go ahead, Rennie.
So agree with Director Obrecht that our hope is that you don't, with this bill, restart programs and take new applications. The situation that you alluded to of applications that didn't even get put in because of timing, there were certainly, as all the programs happened, there were many instances where people didn't apply because they knew they couldn't meet the December 30th deadline. And with broadband programs, for example, those applications were in June and July, I believe, and people just didn't apply. So with a new deadline of the end of the year, if we wanted to restart that program, for example, we'd need to open it up to make it eligible to any company that wants to apply under those parameters. And 56 million was the number in 2020. There could be another large appropriation to that, but at this point, the dollars aren't there. So the programs that we're really trying to target are hospitals. You certainly had quite a few hospitals and long-term care facilities that were approved for projects but could not complete them by the December 30 deadline. There are some instances of broadband programs, but few. And there are some instances of the Energy Rebound program, so oil and gas projects that weren't completed by that deadline, but were approved before. So we think that this is a pretty small universe to wrap those programs up. And then our request would be to sit down and be strategic to say, not every program is extended into 2021, and we'll reopen and take applications. Let's narrow to say what our priorities are, what are our needs still, and what are our opportunities. And as new dollars come in with new parameters on them, that may allow us to do something new and potentially more impactful.
Now, included in that, you didn't mention it specifically, but I don't know if it's was omitted by intention or not, but there were some ag programs that had applications that were submitted and approved, but could not be expended because there just wasn't time, and delays in many instances were at least, maybe not be the sole cause, but were significant cause were COVID issues. Are those omitted by intention, or was that just, you were just giving examples and those aren't necessarily excluded?
Mr. Chairman, there are certainly some individual programs here and there, but within the agricultural, we had 2 agricultural programs. One was a meat processing program, and that one we were able to work with most of the meat processors who applied and had delay issues, because again, it was out of their control. And that is the case with many of these applications and projects. When it was out of their control, there are means to help them deal with getting paid for the projects or the purchase. If it was delayed.
Rennie, I had a discussion with Stacia just in the last 2 weeks, and in the meat processing one, I think there were 2 applicants that, in talking with Stacia, because they were not able to do it, and Stacia's comment was that that there was no authority to do that without further legislation to assist them, because there was a hard stop at the December 30 under the original program. And so, I mean, what you said and what I heard from Stacia seemed to me a little bit incongruent.
Mr. Chairman, are you saying they didn't apply, or they applied?
No, they applied. They applied and were awarded. But for example, they couldn't get equipment out of factories because factories were shut down because of COVID, and there were delays on getting equipment and other things like that. They couldn't get that money expended by December 30. And so Stacia has indicated the department is unable to extend or do anything without further legislative action to assist those. There was two in particular that were awarded grants, but essentially little or none of the grants that they were awarded were able to be expended by December 30.
So, Mr. Chairman, so that one we think would qualify under this program, under this bill, because they were approved in 2020. So we were able to work with many of those meat processing applicants who did make the purchase, and the delivery was coming, but it was going to come after December 30th. But I think the instance you're talking about is they probably canceled their order because it was delayed so significantly.
No,
So
they didn't. No, that's not correct. The answer, I mean, these folks have expended substantial amounts of money, are moving ahead, but now their grants evaporated unless there's further action taken to extend that in somehow.
So, Mr. Chairman, agree with you that there definitely probably are some examples, 1 or 2 within some programs that are like this, and that is true that that agency would be getting the advice they cannot proceed with making that payment unless this bill passes.
And so that, I think that goes back to Chairman Nicklin's request is, I mean, we'd like to see some list of the population of these things so we can see kind of who's covered, you know, who's out there that's covered by this among our constituents across the state, so we can see, you know, who's covered by this and who's not covered by this, because I think we're all getting, or many of us are getting, calls from constituents and others who are concerned about funding that they thought they were going to have, but you know, they may not be there now, and or is not there now without some kind of action. And we just want to make sure what this covers. And so we'd like to see some kind of list of what that population is. And you guys have, I think you have some idea about that because of the language you've got in here in your statements today. You guys have a good idea who those folks are.
Mr. Chairman, clearly I don't have a perfect picture of that, but definitely we've got some of it. There are challenges because we were able to work with some people who had delays and we're still able to process it, and others, I think maybe there are instances where that we weren't. So certainly, you know, that's what's clouded this a little bit is we feel like we've been able to help some people as we look at their contracts, and in other instances the program rules were different. So
right, and so help us help you by getting us that list so we can help find those folks who are falling through the cracks. I mean, at the end of the day, that's what it is. We've got constituents who are falling through the cracks, and we just want to see if we can, you know, they seem to me to be fully would be covered by this, but we don't know if you guys understand and know who those folks are, and we just want to make sure you do. Does that make sense?
Mr. Chairman, absolutely.
Okay, thank you. Other questions about the bill? Representative Schwartz.
Thank you, Mr. Chairman. And I just want to make sure on page 2, I think it's line 20, where it references essentially the NGOs to do case management and housing support. I just want to make sure that you think that language is broad enough if the federal guidelines change significantly.
So Emily or Rennie?
Mr. Chairman, yes, Representative Schwartz, we do believe that that language is broad enough to capture any changes within the guidance.
That's
So
the answer I wanted to hear. Thank you.
thank you. And just to follow up on that point, I mean, we're talking about that, I guess 10% of this money that's coming down for this program can be used for administration. Is that correct?
That is correct, Mr. Chairman. 10% of the funding can be used for administration and case management.
And case management. And so, you know, in many of our programs, you know, we would look at somewhere that, you know, just out of statute and just off the top of my head, we've got 1% to 1.5% that is kind of scraped off by the agencies for their additional costs and their additional overhead. And so, you know, in thinking, I mean, it looks to me like if that's the case, there'd be somewhere between 8 to 8.5% of the total grant that would be available to push down to whether we're hiring, you know, temporary staff at NGOs or hiring temporary field staff for DFS or however we're doing that. Is that what you're looking at? Is that what we're talking about, Emily?
And Mr. Chairman, that is what we're talking about, and I would say it might even be more than that. As I mentioned before, we expect changes, not just within the guidance, but potentially within the legislation itself. So one of the pieces of the reconciliation bill that is before Congress now, in the draft that we've seen, actually increases that number for case management specifically up to 15%. So we could be looking at up to 15% to go out to nonprofits.
So Emily, what that means is that we've got $20 million to effectuate this program, right? And it may be 30 million.
That is correct, Mr. Co-Chairman. So in the current legislation, we have $20 million for administration shared with case management, yes.
And so I guess it goes back to our original conversation is if we have $20 million sitting there to implement this program, then as you and DFS put this program together, they need to go out and as fast as they can figure out how to spend $20 million to maximize the implementation of the program, right?
Exactly, Mr. Chairman.
Yeah. Okay, thank you.
Other questions about the bill?
So I do have, I'm going to on page 2, line 16. You designate the DFS, and then as 2 other state agencies or entities. And I take it that or entities is, and actually, then I kind of lose track of what that really means. It says state agencies or entities administrative functions. So to me, we're missing a word or two in that line. But I'm curious about the definition of entities. Entities could be anything. It could be a county, it could be a city, it could be an NGO. That's my question. Do we need to broaden that language and make it more encompassing is my main concern.
Matt or Emily? Matt, let's start
I can take the first crack at it, Mr. Chairman. And Chairman Nicholas, so when we drafted that, I think the purpose was that DFS can authorize, or I'm sorry, can designate other state agencies or state entities to conduct administrative functions under the program. So, and then if we wanted an entity not under the complete control of the state to conduct some sort of function under the program, that's covered within the next sentence for the grants that will be handed out to do that. But the actual administration of the program will be handled by state entities. Emily, I hope I covered that correctly.
I guess my point is, what if they don't have the capacity to do it? And what if you need help from a county or you need help from a city or some other entity? Why wouldn't we grant that authority and broaden the language to do that?
Mr. Chairman, and I still think they can do that under this language. They would just enter into a contract with those entities to do that function.
But I think, so let me add, so would a political subdivision or a municipality qualify as a state entity or a state agency or entity?
Mr. Chairman, no, they probably wouldn't. You know, they're a political subdivision. They're not an entity of the state. Now, they are under the complete control of the state. But I think to get back to Chairman Nicholas's point is that how that would be handled would just be simply through a contract or an MOU with the state entity, DFS, or any other state entity that's got administrative authority between that entity and the political subdivision.
Okay.
Well, I guess the question is, what if we want cities to do it? Because they're on the ground, they're boots on the ground, they can get it done, and they can then help give out grants for their local NGOs to do it. I mean, why hamstring this thing when we know we're not going to have enough time or people to implement it?
So what's the answer to that question, or is this what's required under the statute? So help us out, Matt.
Mr. Chairman, and I still think I've got a phone a friend left here, so we'll let Emily. But I do think though, to get back to your basic question, I don't think there's anything in this language that prevents the state from immediately contracting with the political subdivision or for entering into an MOU for administration of this program.
Well, yeah, that might be correct, Matt, but it takes the AG's office 3 weeks to review a contract, and it takes their legal counsel 2 weeks to get back in response on it. And that's only after the language comes out. I'm just trying to say, hey, just call them up and say, yeah, you guys can do this. We give you authority to be the granting entity in your community under these guidelines. So I'm just, kind of thinking out loud as we do this.
So let's go to Senator Guru, and then we'll go back to Emily for see if we're running too far afield on this. Go ahead, Senator Guru.
Thank you, Mr. Chairman. I just want to build on what the co-chair was saying. I totally agree. And so that's what I was looking to do is if we're going to amend this to include NGOs, would you do it in line 16 or would you do it in the next sentence on line 18? But somewhere I think it needs to be in there or language that specifically calls out cities, towns, NGOs to make sure that we get past exactly what the good co-chair was talking about.
So Emily, help us out. Is this permissible, or if we do this, do we step on our own necktie under the statute?
Mr. Chairman, thank you for the question. I will point out the reason that we used that language state entities was specifically to capture WCDA and the Wyoming Business Council. And so that's why we use that word state entities. I do think it sounds like the committee might be moving in a direction of an amendment that would provide the ability for DFS to give administrative authorities to counties or cities. Personally, I think that sounds like a great idea. I think we could use all the help we can get.
Okay, thank you. Other questions, members? Representative Stiff.
Mr. Chairman, question for Ms. Solai relating to on page, I believe it's page 2, line 21, and then going over to page 3, line 3, which exempts the department from competitive bidding requirements. My question is this: does it make sense to have some boundaries on that so that, for example, a particular landlord doesn't say, well, the rent used to be $700 a month, but for you, we give you a special price of, $1,400 a month.
Mr. Chairman.
Go ahead, Emily, help us out.
And Representative Stiff, so that language about exemptions from procurement requirements was not to allow DFS to more easily get benefits out, get the payments out to landlords. It was to be able to enter into contracts for things like software, for temporary staff, for project managers, to have this sort of private-public partnership for this program, given, as has been mentioned many times, the administrative difficulties that will be a part of this program. I think what you're speaking to, Representative, is the need within the administrative process for us to build in fraud protections, and that is something that DFS is working on. so that a landlord can't suddenly increase the price of rent in order to benefit from this program. Did I answer your question?
Representative Stiff?
Mr. Chairman, as a follow-up, so even for, software contracts and the like, would it make sense to have some language requiring the department to at least make good faith efforts to obtain the most favorable pricing from service providers in connection with such rental assistance? I mean, wouldn't it make sense to have some obligation that, you can't just buy the most expensive product possible?
Emily?
Mr. Chairman, Representative Stiff, I'll leave it to the committee to determine whether or not that language would be reasonable. I will say that Department of Family Services is currently doing just that. So they are looking at all products that are available, for example, from a software perspective, from off-the-shelf products through products that would require some state involvement to set up in order to find the best pricing and also in order to find the best benefit for the state moving forward. So DFS is engaging in those good faith efforts right now.
And all these expenditures will show up on the open book expenditure disbursements on the that the auditor has, I'm assuming, as they're expended. So they will be transparent one way or the other. Correct? So thank you. Co-Chairman Nicholas.
Yeah, I'm going to page 3, lines 13 and 14. The end of 13 says, it talks about it has to be approved, and then it says by all necessary entities within the executive branch. And my question is, does that include the Attorney General's office? Does that include applications that they said that didn't meet the guidelines? And what's the purpose of that language? What happens if we strike that language? So it says, it only says by the executive branch.
Matt, do you have any ideas? That's more of a legal, or that's a combination legal and function question.
Mr. Chairman, so Representative Nicholas, to your first question, yeah, that would have included the requirement that the AG approve the application prior to December 30th, 2020. If you were to strike by all necessary entities within the executive branch and just leave it as approved by the executive branch, I think you're just opening it up to allow the executive branch the interpretation of what that phrase then means.
And then my next question is, going down to line 15, it says the executive branch prior to December 30th shall be funded as provided in this section. But on the other hand, we limit that to $20 million, right? But that's not what this line says. So I'm wondering if we need to put in shall be funded to the extent funds are available as provided by this section, if that is more appropriate. So they're a little bit inconsistent. That makes sense, Matt? Or is it?
Mr. Chairman, I think what you want to include is shall be funded as provided in this section to the extent funds are available. Right. I think that'd be great. Yeah.
And that's not just the administrative, that's all grants. So I mean, it's the full enchilada on all the money that comes in for this program. It covers all of that. Is that correct?
So Mr. Chairman, just to be clear, what Chairman Nicholas was discussing was the remainder of the CARES Act funds. So this is just the $20 million for CARES Act, not the full federal rental assistance program.
Right. So which brings up the other question is, there are competing, that we've already passed one bill. I don't think it's gone to conference committee yet, but we've already passed one bill in the virtual session. In talking with other legislators, I know there are other bills coming out to try and appropriate against this $20 million of unexpended funds. And so, this is a little bit broader than Chairman Nicholas's question. But how do we reconcile that as a JAC? There's only going to be so much unexpended money out of the CARES Act. We've appropriated it, you know, in House Bill, whatever it was, which hasn't been, like I say, it hasn't been passed both, I think it's passed both houses, but it's set for conference committee. And there's going to be other one. So how do we reconcile that moving forward? Because there's going to be various claims against these unexpended funds, whether it's 20 million or whether it's 15 or whether it's 30.
Mr. Chairman, great question, and I'm going to answer it, and then I do need to get off, so Dave Groover will be able to walk through the rest of the bill with you and make any necessary amendments. But this committee may want to think about, in either this bill or another bill, a section which provides controlling law, a superseding section that this bill will supersede all other appropriations of CARES Act funds enacted during the 2021 general session. And Mr. Chairman,
may get this bill killed, but we'll see.
It certainly could, Mr. Chairman, but I think the point you bring up is valid, is how many different ways can we cut this pie? And I think one issue is we're appropriating and allocating funds in these other bills where we don't have any idea how the state auditor or the treasurer will implement those bills. And without clear legislative guidance on how to divvy these funds up, we're creating a bit of an administrative headache for everyone.
So essentially what we do is can create not necessarily a superseding language, but language that says of all existing COVID-1 funds, this is the priority of distribution on anything that's funded through a separate bills. And that would be all and so we could prioritize what this bill does basically, which is applications that have already been approved and got, which is, you know, what we believe to be that's around 14, 18 million, Rennie, something to that, or 14 million.
Well, Mr. Chairman, we can definitely do that with this language. I think that's a good approach. But what my other concern is with any of these CARES Act dollars that we retrieve from FEMA, the legislature, by language that was used in bills that may be under consideration, may have already passed, we could piecemeal appropriate those funds without a clear understanding of what the legislature is doing. So I think that it might be in the best interest of the legislature and of the state if this committee would consider language in this bill or in another bill that would restrict any of those appropriations until further act of the legislature.
Well, then which we might be able to do that, like for example, what about a section 300 in the budget bill that then allocates among all, you know, which we could do late and would ultimately end up in a conference committee, but somehow, some way we've got to reconcile the claims on this unused, this available CARES Act money. That's the point, I think.
Mr. Chairman, that's my exact point.
So Senator Steinmetz.
Thank you, Mr. Chairman. I guess for me, what's confusing me in this bill is the fact that we're combining the old money and then standing up this new program with the rental assistance under the Department of Family Services. And so I wondered why we put those two things together. That was one of my first questions. And then secondly, I am a little uncomfortable with how we're basically giving this I thought that the governor's office will be the one in charge of appropriating the whole amount of those federal dollars again that remain and running that through the AG's office again. So I mean, we have individual bills out there. Is this just sending it all back to the governor to decide how that's distributed, or will we still retain some control on that? So those are my two questions. Thank you, Mr. Chairman.
So Director Obrecht, or you need to run, and we need to turn this over to Mr. Gruber?
I will get this answered and then and maybe stick around for a little while longer and then need to leave. But Senator Steinmetz, to your first question, Yes, definitely this could be two separate bills, but they do fall under the broad canopy of emergency federal funding to the state to deal with the COVID-19 pandemic. So it was appropriate constitutionally to put this in one bill, but if the committee wanted to split this out and make two bills out of it, that would also be appropriate. It just seemed easier for everyone to handle this in one bill rather than two. And to your second question about the remaining CARES Act funds, remember, this is only limited to $20 million of whatever CARES Act funds may be available. So any other money that either the state recaptures in CARES Act, either through FEMA or other means, would not be included, would remain unappropriated by this bill.
Okay, thank you. Representative Larson.
Thank you, Chairman Perkins. Just one point, Chairman, you mentioned the bill coming out of the Senate, which is Senate File 50 on the COVID ag stuff. That's in the House JAC. It's not been heard yet. And then my question back to you and Co-Chairman Nicholas was on this FEMA discussion is just not wanting it to get lost in the woods. Is that something that we need to consider putting in the bill? If I understood correctly, we didn't have that. That wasn't a component of the bill that would allow us to deal with those reallocations, or is that something you think was you was looking at later down the line? Just clarification for me, please.
So I think the answer to that is that the governor is asking us to do that at a later date in a separate bill or separate action. Is that right, Rennie?
Mr. Chairman, that's correct. I would point out again that there, with the programs that already exist in statute that would be necessary for COVID response and still meet the federal guidelines, dollars could be used for those. But all the programs that were created in the special session and the authority to create new programs that was given to the governor in the session law, those are all restricted to the 20 million.
Okay. Mr. Obrecht, Director.
Mr. Chairman, maybe just for the Joint Appropriations Committee's education or knowledge on this. So currently with these CARES Act funds, your enabling legislation for the governor to create new programs in which to expend these funds has expired. So the governor's office, with any CARES Act money remaining, what they can do is expend those funds on existing state programs, but not state programs that were created in the special session legislation, because those have expired. So by way of example, the legislature has recently submitted a request for reimbursement for CARES Act funds to get ready for the session for IT. That is allowable. Anything that deals with a Department of Health program that was already created, or a DFS program or workforce services program. But what the governor's office couldn't do is consider a new business relief program or a new agricultural relief program. So they are limited on how they can spend these funds without further action of the legislature in creating new programs.
Other questions? Okay, if there's no other questions on the bill, I think we're ready to open this up for public comment. So, Director Obrecht.
I wish I could stay here because I have to go give a sexual harassment and anti-discrimination training to session staff. So, but I'm sorry I can't. But obviously, you're in very capable hands with Mr. Gruber.
Okay, thank you, Director. Appreciate you, Matt. Let's go ahead and we've got public comment. So, Karen, are you going to start how many people have we got lined up, Karen?
At this point, Mr. Chairman, excuse me. At this point, we have 2 people that have raised their hand to provide public comment. I will go ahead and bring them in. And as others appear, I will go ahead and bring them in one at a time. So I believe we're going to start with Joshua Watanabe, and then we will have Rick Kaysen, and then I believe Eric Boley, and then we'll move on from there.
All right, thank you, Karen. So the only person I've seen show up so far, the list you gave, I haven't seen anybody show up on the list you gave me so far. Maybe my screen, oh, there's a second screen. All right. So I see somebody calling in by phone. Is that one of our public comments? We've got the Rick, that's you. Rick, why don't you go ahead? Rick, if you can hear me, you're still on mute.
Okay. Okay. Mr. Chairman, Rick Kaysen here by phone, and thank you for that. And can you hear me okay, sir?
Yes.
Okay. Thank you for the opportunity to share some thoughts and comments with you in the committee, and thank you for allowing this to be done by phone. Again, I'm Rick Kaysen. I'm representing Rocky Mountain Power. And yes, unfortunately, there are customers that are behind in their utility bills across our state. And we believe that this bill certainly can help those customers. And we do support the bill along with what the governor's office has stated. Our support is consistent with how Rocky Mountain Power has been and is working with its customers who are struggling to meet their financial needs via payment arrangements, avoiding service disconnects, working with the Low-Income Energy Assistance Program, Energy Share of Wyoming, and other assistance programs. So there's some continuity in the support we have been giving our customers. Just a few details to show how there is a definitive need across our state. Within Rocky Mountain Power, we've identified approximately 7,500 customers that are rental customers within our records, and they are past due on those bills. And there's likely more rental customers that we just cannot identify. We have more than $1.5 million that customers are in arrears at this time. And unfortunately, some of these dollars are going are in the thousands of dollars. Very difficult for these customers to meet their financial needs. And with this type of a support, those customers then can use their other disposable dollars for other needs like food or medicine or what's on their plate at this time. We certainly believe that this bill can benefit Wyoming citizens. And we're also offering our assistance to help letting customers know how to apply for the available funds. So since you lost 30 minutes earlier, sir, I'll keep this brief and try to answer any questions you or the committee members may have. And once again, thank you for the opportunity to share some thoughts.
Thank you, Mr. Kaysen. Chairman, Mr. Co-Chairman.
So my question is, would it be helpful if we put some type of a provision in this that allows, that protects the respective parties on the confidentiality of names and folks that are part of that $1.5 million past due amounts, to facilitate the communications and finding out exactly who those folks are without violating anybody's rights, or at least protecting the parties. Have you thought anything about that, Rick, or has Mountain Power figured out ways around that issue?
Go ahead, Rick.
Okay, thank you, Mr. Chairman, Mr. Co-Chairman. I cannot specifically identify an exact strategy as far as protecting those customers, but I do know that, again, with confidentiality rules and with practices where Rocky Mountain Power, there would be some provisions in there to protect those customers with the proprietary information and confidentiality, and treat those customers with the respect that they deserve.
Thank you. Any other questions for Mr. Kaysen? Any other questions for Mr. Kaysen? Rick, just really quick, out of curiosity, and you've done some of this and worked with Rocky Mountain Power on some of this so far. How does that has there been any problem with Rocky Mountain Power obtaining the necessary information from their tenants, or excuse me, their customers, so that they can get the information that they need, so that they can show that the app that who they're applying for actually has qualifies for the utility assistance?
Mr. Chairman, I'm not aware of any barriers that exist. I would liken this again, as I mentioned earlier, to the other assistance programs like low-income energy assistance program, a federally funded program where there are guidelines to gather information as well as protect those customers. But the overall objective, of course, is to provide assistance to those that are in need. And again, I think the bill does this, and I know that Rocky Mountain Power does have guidelines that to meet those needs.
Okay, thank you.
So just to follow up, Mr. Co-Chair,
let's go to Representative Keenan, and we'll come back to you, Mr. Co-Chairman.
Thank you, Mr. Chairman. For Mr. Kaysen, I'm just curious how the 7,500 number would compare to, say, a normal past due kind of a situation that you might see. So say maybe a year ago, I'm just curious how that really compares to what you might normally see from a past due standpoint.
Rick?
Mr. Chairman, Representative, I do not have that data immediately available, but I can only assume, because of loss of employment, because of reduced work hours, that many of these customers are new to the arrears theater, if I may, and were not experiencing this difficulty back in 2019, for example.
Okay, thank you. Co-Chairman, Mr. Co-Chairman.
Yeah, and so, Rick, I would think it would be fairly simple for Rocky Mountain in their monthly billing process to provide notice to anyone that's in arrears and anybody that's about to go into arrears that public funds are available, and then just provide a website or a phone number or some other information to them to facilitate what DFS is doing. I don't see any reason why you couldn't do that. And you can work with DFS on how to word it.
Mr. Chairman, Mr. Co-Chairman, yes, that is what I tried to allude to in my earlier comment, that Rocky Mountain Power would assist in letting customers know how to apply for available funds. And once those details are known, whether it's via a website, one of the entities in the earlier discussion, a telephone number, yes, that is what I was alluding to. And there's the monthly insert in the bills and what have you to bring customers up to date. And that would be consistent, again, with what we've done with other assistance programs in years prior.
Thank you. Any follow-up, Mr. Co-Chairman? You're good. All right. Any other questions for Mr. Kaysen? Seeing none. Thank you, Mr. Kaysen. We appreciate your time today. Let's go next to
thank you.
Mr. Watanabe.
Thank you, Chairman Perkins, Chairman Nicholas, and the committee. After listening to the discussion this morning, I'm speaking from Laramie Interfaith, one of the NGOs here in Albany County. And I wanted to provide maybe a perspective. I know that the ability of NGOs to receive this funding is still in question, but when it comes to the application process, the gathering of all of this information, the keeping it confidential, the communication, this is a process that Laramie Interfaith and many other nonprofits around the state are already doing. That case management that is being discussed, this is what we go through with our clients. We help them complete the applications. We do the income verification, the determination of need, and then all of the payments that are made directly to landlords or to the utility companies. So we're not, we're working with the landlords here in Albany County. I know we know many of the landlords on a first name basis. We're on the phone with them regularly. And so we work with them to get them their money directly. The timing of this, that was an issue that was brought up. This is within days. Usually that determination is made. We're able to go through these applications and make that determination on a case-by-case basis almost the day of. And so this can happen very quickly. Administratively though, and you will see in the materials provided, my organization did about $200,000 in assistance last year financially. We received about $400,000 in requests, and the $400,000 was capped at our ability to process these applications with our clients. So when it comes to that case management and the capacity that you've talked about, organizations like mine, we are running at capacity right now. We are handling as many people every day, going through what amounts to 10 or 15 pages of an application to qualify for other federal programs. But that is a concern for us moving forward. We want to help the legislature and the state get this money out, to make landlords whole, to make the utilities companies whole, to keep people in their homes. But we just have a paperwork, capacity, a limitation. There's only so much that we can do. And that's it. Thank you.
Thank you. Questions for Mr. Watanabe? So I do have your comments, and Mr. Watanabe, thank you for the work you do in your area. We appreciate that and recognize what a great contribution organizations such as yours around the state provide, oftentimes with very little or minimal government assistance or government input. And we recognize you pull together a lot of resources from a lot of places to serve your people, and want to know that we appreciate and recognize what you do, as well as similar organizations and other nonprofits and NGOs around the state. So first of all, just thank you. Second of all, one of the things we talked about today is, you talked about your capacity. If there were administrative money that was available, not only, so we have, if this money is received and the programs are approved, it comes down to you. There's money both to provide assistance, but there's also the ability to have some of the money that's appropriate that comes to provide for assistance, or for case management. And so as you provide that effort down there, if you had the ability to hire some part-time or some additional people for a little while to make sure this program gets administered and to assist in your community, do you think that you could have the ability to make those temporary hires and increase your capacity temporarily to deal with what we anticipate might be a continued increase in the amount of applications?
Sharon Perkins, thank you. Yes, we are looking at ways to increase our capacity should this funding come through, and within the limits of the federal grant itself. Obviously, there's only so much money that can be applied administratively, and we need to draw on other sources to make up that. But that is something that my organization is looking at specifically. How can we increase capacity if this funding goes through? Again, because I know we're only measuring a portion of the need that we have in this county.
So do you think you could increase that capacity? I mean, as you look at it, do you think there's that ability to increase some of your staff temporarily or things like that, so you could increase capacity? And there's some retraining and some other things that have to go along with that. Do you think that your organization, just as an anecdotal evidence for us, has the ability to make those increases temporarily?
Yes.
Yes. Okay. Thank you. Other questions for Mr. Watanabe? Again, thank you for your time, Josh. We appreciate what you do. Thank you. Mr. Bowley, Eric, it's good to see you.
Good to see you too, Chairman Perkins. I'm Eric Bowley, President of the Wyoming Hospital Association in Leading Age, Wyoming. And just wanted to offer our support for this legislation. This is really important to our hospitals and nursing homes in the state. as you're all aware, COVID is taking its toll on our state and also on our healthcare providers. And I'm grateful and honored to be able to represent the great men and women and the organizations that have protected the citizens of Wyoming, the frontline workers, and all the hard work they've done. In respect to this particular piece of legislation, this bill, we really feel like this is important. We started looking at the Treasury guidance early on when it was first issued back in, I think it was in April or May. And we identified needs around the state on things that we could do to shore up and to build our capacity to deal with COVID as it started to spread across our state. Once the special session was held and there was money allocated for utilization to do different projects around the state, we worked closely with the SLIB board and with our membership to help vet and go through the different applications that they would submit. One thing that we found in our state is a lot of our hospitals and our nursing homes are aging. A lot of them were built in the 60s and 70s. And our ability to treat and care for COVID patients was diminished because of aging plants and equipment. So we took a look at the guidance. Our membership looked at the needs that they had, and we submitted those applications. The first application was actually heard sometime in July. And then every month thereafter, we had additional hearings where the applications were reviewed. We have a lot of capital construction projects that have been put in place around the state to increase our capacity to deal with COVID. Most of them had to do with air handling units and being able to create negative pressure rooms, isolation rooms to stop the spread of COVID. We stood up temporary and permanent facilities to do testing. We had to change the way that patients flowed through our facilities, whether it was in our clinics or our hospitals, and then in our nursing homes. Most of our nursing homes are semi-private rooms. And what we found is that cohabitation was deadly as COVID spread. And so we tried to mitigate what might happen in our nursing homes. And to a large degree, we've done fantastic things in keeping COVID out of our long-term care facilities and protecting those residents. But we do have some projects that were started with full intent and full purpose to have done by December 30th. Due to COVID, many of those projects did not get completed. There were staff members that got sick. There were contractors that got sick. Supply chain dried up because of the demand across the country and across the world. And so we have many projects that are either completed now or almost completed. And because of the guidance and what was put in place, we have balances that have been expended but have not been reimbursed through the CARES funding. And so we support this so that we can make those facilities whole. So I'd be willing to answer any questions, but I'd ask you to advance this and help make those facilities whole that have done so much to protect our residents and citizens of Wyoming.
Thank you. Questions for Mr. Boley? Co-Chairman Nicholas.
Thank you. Eric, I think we'd like a list from you so we can cross-compare the lists of what you think was approved and unfunded and what we received from the executive branch, just so that we do our homework. So I just think it would be a useful thing to do. So if you're willing to do that, and how much for each entity, on particular projects, I just think it'd be valuable for us to know. And then I have another question, and that is, are there any ECMO machines that are available in Wyoming at any of the healthcare facilities?
Mr. Chairman Nicholas, both great points. So I'll answer the ECMO question first. My understanding is that Wyoming Medical Center was getting ready to stand one up. I don't know if it's been completed yet. That would be the only one that I'm aware of in the state. One of the big problems is the training and getting people in that can do that. When early on, we had to transfer, if we could, patients down to Denver area to get those done. But Wyoming Medical Center was in the process of getting one of those in place.
My understanding, Eric, is that they won't take patients, basically, if they're already that far down the line on the COVID, so it's hard to transfer.
Well, Mr. Chairman Nicholas, I've only been involved in one of these. We were made aware of a patient that needed it from Natrona County, as a matter of fact, and we were able to set up a transfer, but the patient was already in too bad a shape that they probably wouldn't have survived the transfer. So there is a little bit of success, but you're right, it is hard to get them transferred out. I think a lot of it has to do with how far into the COVID process the patient is before we can safely transfer them.
Well, would it be fair to say, Eric, that if we had one or two in Natrona County or Laramie County or Jackson, that it would be saving lives?
Mr. Chairman Nicholas, there is I think it's about a 40% mortality improvement rate in survival of those patients that are seen and use the ECMO treatment. So I would believe that, yes, if we could get one in place and get patients there in a timely manner, that we might be able to save some lives.
So if you would, I'd like to get more information about where Casper is and what the costs are. And, you know, if for training purposes, if somehow we can coordinate with some folks in Colorado or Salt Lake in order to facilitate the training and have them, you know, with our current using the internet, we can probably have training done online and have people, various docs, implementing and taking care of these guys as it's being as it's being set up. So there ought to just be ways to partner one way or another. So,
Mr. Chairman Nicholas, I'm happy to follow up with Wyoming Medical Center and get more information. I agree with you. I think it would be a great tool to have for us in our state.
So, and for folks that are watching and don't know can you just help us understand what an ECMO machine is?
Go ahead, Eric.
Oh, Mr. Chairman Nicholas. So it's basically and I'm not as up to speed as I should be because it's just not my bailiwick, but it's a treatment that helps to improve the lung function. My understanding is when a COVID patient is diagnosed, when you take a look at their lungs, a patient that has pneumonia, it appears as a dark mass in the lungs. When a COVID patient is x-rayed or looked at under CT, it actually looks like the lungs are shattered. It looks like shattered glass, and it affects almost the entire lung. And so the ECMO machine, I think, is something similar to maybe bariatric treatment, where it actually helps to open up the cells and it helps to allow more oxygen to move more freely through the lungs and helps with the oxygen and lung capacity.
Okay, thank you.
And I don't even know what the acronym stands for. I'm sorry. I can look it up for you if you'd like.
Okay. We probably wouldn't remember anyway. It's too long.
Mr. Chairman.
Other questions for Mr. Boley?
Mr. Chairman, there's two parts to that. Chairman Nicholas also asked about comparisons. What I can tell you is we've worked closely with the OSLI. I have the list that maybe they provided you of the capital construction projects. I think we had about 38 of them that were approved, not only for hospitals and nursing homes, but there are some clinics and mental health centers and other things that receive that funding. This is a moving target because they're still processing some of those payments. We've actually been on the phone with our members up until just 30 minutes ago, getting what has been paid and what is still outstanding. I'm happy to provide that information to you. It looks like at the current time, there were about $34 million that were approved for capital construction projects, and outstanding for hospitals and nursing homes. It's roughly about 12 million that has not been paid to this point. There are other buckets of money, and you guys identified different buckets of money that you want to look at, and this would be bucket one. There were other projects that were approved by the SLIB board, but because of the timing, those projects were not started, and we're not looking for funding for those right now. We're just trying to get the projects that are basically complete, just funded. However, with the extension, and we actually worked really closely with Senator Brassel's office and other leaders back in DC, we really wanted this extension. And when President Trump finally signed it on December 27th, which was very late in the game, we actually felt a little bit of relief because we knew some of our projects had been delayed. and we were excited that we might be able to get that funding through the end of this year. But there are other important projects, I think, as we take a look at the variants of the COVID virus. We worry that we might see an uptick. We hope not. We're really happy with the progress that's been made in our state and the numbers, the way they look. But there may be other projects in the future that might make some sense, especially as we start to understand how to treat COVID, and it's changed from the beginning to where we are right now on how those treatments are given. And so we would also be interested in that second bucket that you talked about, potential projects that could be funded with funding that remains. But our main priority is just that first bucket, just trying to get these folks made whole for money they've already expended.
Thank you, and please get that to us. We want to understand what it is that this bill is potentially does, and for whom it, for who's the recipient of those. We need to help understand that so we can help move this through. As we've said earlier, there's a lot of people looking to take advantage of these unencumbered or other unspent COVID funds, and we want to make sure that there's a lot of us that think that the state ought to live up to those original obligations, and that those original commitments, though it was unable to, for no fault of the states and no fault of the applicants that were approved. So if you can get us that information, I think it'd help us a lot. So thank you, Eric. Other questions for Mr. Boley? Again, thank you, and we appreciate the frontline workers. I know the almost week I spent in the hospital, they were absolutely tremendous, excellent care, and talking with them, they were worn out, they were frustrated, but they were still putting in hours and providing just great care. So anyway, thank you for that.
Thank you, Mr. Chairman.
Co-Chairman Nicholas.
Yes, the ECMO machine, basically, it's like it works by oxygenating the blood. And basically it takes the function of both the heart and the liver. They take the blood outside the body, oxygenate it, put it back in the body. And by doing so, it doesn't overwork your heart, because when your lungs are congested with the virus, it causes your heart to overwork, but it's not it can't oxygenate the blood. So it's kind of the last gasp, and usually done if a ventilator is not enough to assist. And it's saved a lot of folks that are on that critical path. That had there been one in Casper back in March, we would still have perhaps a legislator still around today. So.
Yeah, thank you. Thank you, Eric. Is there anyone else? Ms. Carr, are you here to give public comment? Go ahead.
I am. Thank you so much. Co-Chairman Perkins, Co-Chairman Nicholas, Joint Appropriation Committee members, thank you so much for the opportunity to be here with you today. My name is Susan Carr, and I am the Executive Director of Compass Center for Families. We're a nonprofit serving Johnson and Sheridan counties, but today I'm also here as the Executive Director of Community Services Network of Wyoming. CSNO is a membership organization made up of all eligible entities who receive federal community service block grant funding in our state. Our community action agencies, both public and private, represent all 23 Wyoming counties. As current federal law and legislation enacted in 1964 during the War on Poverty dictates, CSBG eligible entities are tasked with working with and for individuals and families experiencing generational and situational poverty. These agencies provide stabilization, emergency assistance, as well as case management, working closely with clients to move them away from government benefit programs and toward permanent self-sufficiency. Because of this work, our members work closely with our partners across the state to engage with the most vulnerable among us as we try to tackle important issues like homelessness, food insecurity, and preventing escalations of risk factors that put our entire state in jeopardy. Today, those of us with boots on the ground are seeing and hearing heartbreaking stories of landlords losing their properties or at risk of losing their properties, following farther and farther behind on their payments, and also vulnerable individuals and families losing jobs, experiencing reduced hours, and facing homelessness in the middle of a pandemic and during Wyoming's notorious harsh winters. Earlier today, we talked about and we listened to testimony regarding renters losing their housing. In communities such as the ones I serve in Sheridan and Johnson County, it is critical that we prevent families from being evicted because we don't have the housing inventory necessary to rehome them as quickly as they would need to be rehomed. We have high rental rates, we have very little inventory, and we know that during Wyoming's notorious harsh winters, homeless is the last thing you want to be. COVID-19 has wrecked many of the community social and family safety nets in place that previously assisted those who are struggling. And while CSBG providers provide some federal assistance to fight poverty, there's simply just not enough available funding to make a dent in what's being asked of us. From the loss of high-paying energy jobs to isolations due to the virus, we are seeing more people than ever before reaching out for assistance. Many of these clients we're seeing for the first time, and it's the first time in their experience that they have had to reach out for help because pressures are wiping out savings accounts, ending jobs, breaking up families, and creating trauma at levels our membership and our providers have never seen before. It is our hope that this committee and the legislative body as a whole recognizes the sense of urgency that the data and the anecdotal stories indicate. CSNO urges this committee to really put thoughtful legislation forward, but to act quickly to ensure that the needs of all the residents in this state are met in a timely fashion. Wyoming nonprofits are capable of great things. And with this available funding, most of us can hire and train to increase our capacity to assist in completing applications for individuals and families on behalf of landlords and utility companies, but we're gonna need a little bit of lead time. Passing this bill quickly is important to ensure that we're ready to hit the ground running to serve our clients. Thank you for your prompt attention to passing this bill. This bill will create a sense of hope that is desperately needed, not today, but yesterday. This bill is going to allow us to serve families and individuals with the scale necessary to make a true difference and with the dignity and respect that they deserve in an efficient, fiscally responsible way. We look forward to working with you, the governor's office, and state agencies to start making a true difference in the lives of Wyoming citizens. And Mr. Chairman and Co-Chairman, thank you again for this opportunity to speak with you today. And I would be happy to answer any questions that anyone might have.
Thank you, Ms. Carr. Questions for Ms. Carr? Questions for Ms. Carr? Thank you for we appreciate the work that you do. One quick question for you.
Yes.
With respect to what's the most common government branch of the, or what branch of the executive agencies do you work with the most? Is it DFS?
So my agency does work very closely with the Department of Family Services because we provide CASA services and visitation services for foster children. However, through the Community Services Network of Wyoming, we have our own state agency or office under the Department of Health in the Rural Division. It's the Office of Community Services. And we work under Health and Human Services under the Office of Community Services at the federal level as well. So the majority of our eligible entities that receive federal funding through CSBG are accustomed and used to working with eligibility, making sure that our clients are eligible, that we're following all the guidance and the rules set forth from the federal and the state offices. And we're also very good at reaching out to those families who need us the most, even if they don't know that yet.
Okay, Thank you very much, Ms. Carr.
bet.
Other questions for Ms. Carr? Thank you very much. We appreciate your
Thank
attention.
you.
Appreciate the work that you do in I guess you said in Johnson and Sheridan counties. So
Johnson and Sheridan County, and then around the state. Thank
around
you.
the state. So we thank you for the work that you do. I don't see any, is there anyone else? Karen, that's all I see.
Mr. Chairman, we have David Bush currently in the room, and then we're going to hear from Sabrina Lane and Pete Gosar as well.
Okay.
Those are all that I have at this point that have raised their hand.
All right, thank you. Mr. Bush, go ahead. He blended in right with the other legislators, so I didn't recognize. Thank you.
Thank you, Mr. Chairman. Can you hear me okay?
Yes.
Okay, good. Mr. Chairman, members of the committee, David Bush with Black Hills Energy. Black Hills serves approximately 170,000 utility customers across the state of Wyoming. We do electricity and natural gas in Cheyenne and natural gas in several communities represented by members of the committee here. Casper, Gillette, Riverton, places like that have definitely been hit hard by the COVID situation and the downturn in the energy market. So we're here in support of this legislation to help those folks meet their financial obligations. This is a situation that you've heard a lot about today. I don't want to belabor every point, but it's definitely a situation that we feel this money would be helpful for those folks. Real quick on the part about communication, we've also been talking with our team internally about how to communicate if these dollars are out there, how to communicate with those folks that this program is available. And to Mr. Kaysen's point, we can do bill inserts for those that are still getting a paper bill. We can use social media. We can also use text messages. We have some folks that have authorized us to text them, so we can use that as well to get that message out if these funds are available. So with that, I don't want to talk any more than I need to. So that's it for me, just in support of the bill.
Thank you. Thank you, David. We appreciate it. Questions for Mr. Bush? Questions for Mr. Bush? Thank you, David. Thank you.
Thank you, Mr. Chairman.
Representative Kenner, were you just giving a thumbs up or were you raising your hand? Just a thumbs up. All right, great. Ms. Lane, go ahead. The floor is yours.
Good morning, Mr. Chairman and members of the committee. My name is Sabrina Lane, and I'm the Executive Director of Wyoming 211. Wyoming 211 is a free, accessible, comprehensive, statewide provider of information and referral for health and human services. And as you may be aware, Wyoming 211 is 10 years old. So in addition to our regular services that we've been providing, we have been serving as the statewide helpline for COVID-related questions and referrals since March 16, 2020. Since that time, we've seen a dramatic increase in call volume. In 2020, we recorded an 86% increase in our overall call volume and an increase of 152% in our total referrals made over 2019. And as you heard Ms. Sully refer to our increase in rent and utility assistance, that equated to approximately 1/3 of the referrals that Wyoming 211 made in 2020 for the rent and utility assistance. And over the past few months, Wyoming 211 has seen a continual upward trajectory of callers needing help with rent and utilities. Many of these individuals have lost their jobs, suffered reductions in pay, or had their hours cut. We have worked with landlords looking for assistance for their tenants. We have worked with many first-time callers who have never been in a financial situation like this and are scared and are desperate to find a way out. As you heard Ms. Carr state, community agencies around the state have done an amazing job in assisting these who are needing help, but the resources have been limited. These same community agencies, including Wyoming 211, are ready to hit the ground running to assist DFS in the distribution of these dollars to individuals and families in need of rent and utility assistance. Recognizing the magnitude of this effort, Wyoming 211 is prepared to be the centralized access point for information and referral to direct individuals to the right place to receive this assistance. In addition, Wyoming 211 maintains a website, a comprehensive database, as well as a technology platform that can help this large multi-stakeholder coordinated effort. And much like Mr. Bush, we also have a variety of communication methods that we can put into play to help communicate this messaging. Mr. Chairman, this has been an extraordinary crisis for Wyoming. Tensions, fears, and debt are mounting. Until these folks get on their feet, many won't be able to catch up. That's why this assistance is so needed and why we are here today in support of this legislation. It is important to work intentionally and swiftly on this bill to assist these vulnerable individuals. Thank you for letting me speak today, and I'm happy to answer any questions you might have.
Thank you, Sabrina. We appreciate your testimony and your making the effort to come out today on behalf of your organization and those your organization, more importantly, who your organization serves. Representative Schwartz, you have a question?
Yeah, thank you, Mr. Chairman. So Ms. Lane, I looked at your numbers and what you've just said, and you've been dealing with a huge increase in numbers already. And this program has the potential to, I won't say burden, but increase the numbers you're dealing with. Do you have the capacity to do that? And if you can get administrative support, will that assist? I mean, that's a softball question, but it's more about your capacity.
Mr. Chairman?
Go ahead, Ms. Lane.
Thank you. Representative Schwartz, thank you for that question. Yes, we have the ability to increase our capacity pretty quickly. When we started taking on calls, we were able to onboard a couple of new staff within a couple of weeks' time. So we were able to do that. We do have the technology where we can increase our capacity with the assistance of this administrative support. So we are ready and able to take that on should we be called to the table.
Thank you. Sure, go ahead, Representative Schwartz.
How about individually? Can you handle more capacity?
Mr. Chairman. Yes, absolutely, Mr. Representative Schwartz. We've got it handled.
She still has plenty of hair. It's not all falling, it's not falling out yet. That's right.
It's turning gray, but we're good.
Thank you. Other questions for Ms. Lane? Thank you very much. We appreciate you and your attendance today and the work that Wyoming 211 does. Thank you very much.
Thank you,
Mr. Gosar, welcome.
Oh, good morning, Chairman Perkins, Co-Chairman Nicholas, excuse me, and members of the committee. Thank you for allowing me to testify today. Wear two hats in this conversation. First, I'd like to talk to you as the Executive Director of the Downtown Clinic, a free healthcare facility in Laramie that serves low-income uninsured residents of Albany County. We are the primary care home for 400 to 500 people every year, 2,500 visits last year, volunteer run and led. Most of our providers are volunteers. Why that makes any difference to you when we talk about housing, just recently in the last month and a half, we've been asked to support Mr. Watanabe's Interfaith Good Samaritan. When they ran out of money, we've supported 3 families keeping roofs over their heads. So the need is real, and it seems to be growing. We can't continue that, as you can imagine, for too long. And then we also think about what utilities might mean. And for us, as we made a move to telehealth, as most facilities have, we had a grant from a local organization that allowed us to give people minutes on their phone. You can't do telehealth if you don't have a telecommunicating device, right? And since December, we've burned through $2,000 to get people minutes for their phones to do telehealth. And I'm not sure if that's being anticipated, but that would be cool if it was. It would be useful if it was. So there's the need. I also serve as a county commissioner in Albany County. And I would like to say thank you to Co-Chairman Nicholas for asking about us being partners. We do feel like that is a really hopeful and helpful thing, and we would do everything we could to be partners in getting the word out. As you well know, and at the end of the year, the money that came through the county commissions, just for instance, Albany County had nearly $800,000 to be spent by the end of the year. I wish we'd have had a little more time. Even after the administration, the President Trump signed it, we were able to use 400,000 of those dollars, 440,000 of those dollars. But the time and the paperwork made it really difficult for agencies to access that money. And so we turned back some money that I know if we would have had a different time limit, if we'd have had a different paperwork, that we would have been used well in this community. And I suspect other counties are the exact same way. And then I think my final comment would be, if we're going to do the paperwork, we make it as streamlined as possible. And then hopefully this isn't for you guys, but for people listening, make it in a different language also. Could you put it in Spanish? That allows us, if that's not done, we have to have it interpreted and translated by people who are volunteers. And you can imagine that just adds to the delay. So thank you very much for the opportunity to talk with you. I know you're busy, and I'd stand for any questions.
Thank you. Questions, Co-Chairman Nicholas.
Thank you. And actually, my question is probably for Rennie. So if they had an application then, they received $800,000, they could only spend 400,000 of it, expend it on a timely basis. Under this current law, as that we have in front of us, can they then reapply for the money that they was already approved that they couldn't expend? So that other $400,000.
Mr. Chairman. And Ms. Solak can correct me if I get this wrong, which is possible. That program actually did not expire on December 30th because we were putting it in place right in those days when Congress was acting. So I'm a little bit worried there was some miscommunication there. That $800,000 should be available still to Albany County to spend until, was it March 1st was the deadline, Emily? So it wouldn't be subject to this bill. Albany County has had that $800,000 to expend until March 1st.
So that means they've got 8 days to go get it out of your bank account and spend it? Is there a miscommunication that's happened here? And if so, my guess is this may not be the only one. Be interesting to understand it.
Mr. Chairman, there may be. Those were under the rules. So even if the bill passes, we would have to amend the rules, but we absolutely could do that for those programs.
I think that what it was that it came out late, and so it provided the ability to recover COVID-related expenses that were incurred prior to December 31, but they had until March 1st to submit those on behalf of each county could acquire that information and submit it and then expend from the amounts that they had. So it had to be expended prior to December 30, but they had until March 1st to get those numbers in and have it expended. So so let's go back to Pete. Put on your commissioner hat, Pete, and did you understand that, or are we talking about a different program? I thought we were talking about I think there was 12 or 13 million that came to counties right at the end of the year for expenditure for various nonprofits in your community. And is that the money we're talking about? And is that help us understand where this disconnect happened, Pete?
Yeah, that is exactly correct. And what Mr. McKay and Ms. Soley have talked about are exactly accurate. But the discussion I thought was more about the need of that program and the paperwork required. And it did come out over the holidays. And so before President Trump signed that, we had 7 of the 19 nonprofit agencies able to get us some paperwork worth a couple $100,000. When that was extended, we extended our deadline at the county. And so that offered probably a doubling of the amount of relief that we were offered to our community in our agencies. And I understand the March 30 or the March 1st deadline, but it had to be spent and it had to be in by the state. And so that puts you, maybe February 1st, February 15th, if you really want to get it through and be on top of things. But more, I want to talk about that amount of aid could have been used. I know it could have been used. For instance, there was a part of that program that allowed for people that had canceled fundraisers to recoup if they had a loss in revenue. Well, people have been very charitable during COVID-19. People did cancel their fundraisers. They weren't able to show a 25% loss. And so they weren't able to put in for the loss of the revenue. We worry as a nonprofit world of this year. You know, people were unbelievably generous during the pandemic, but that might wane in this coming year, and the expenses only pick up. And so, Chairman Perkins, I know this is a long, tortured way to answer your question, but yeah, how they explained it was exactly correct. The timeline was something that made it difficult. And so thank you for including us in this early discussion as a nonprofit, but also that the need is there. And just because of timeline and whatever else, I just want to make sure that the members of this committee understand the need and what would happen if you allowed us to access it again. I think you'll have many people able to spend $20 million for you in many, many different ways.
Okay. Thank you, Commissioner Gosar. Appreciate it. Any other questions for Commissioner Gosar or Executive Director Gosar, depending on which hat he's wearing? Pete, thanks for all your work, both at the commission and as a part of that it was that downtown clinic. Anyway, it sounds like you've made yourself very useful in Laramie, and thanks for the contributions you make as well as that of your organization.
Pete, how's your basketball game?
I retired 10 years ago, and I probably should have retired 20 years ago.
You're probably using some of the services at the downtown clinic because of that. So, thank you, Pete. Appreciate it.
Thank you all.
Is there? I don't see any. Are there any other comment? Any other folks that are lined up to testify, Karen? I don't see any more.
No, sir. I think we have covered everyone that had their hand up. Okay,
we'll go ahead and close off public testimony at this point. I see that it's 12 noon. We want to take up this bill. Why don't we go ahead and break for lunch, and we'll come back and pick up the bill at 1 o'clock.
Mr. Chairman.
Senator Kinski.
I was wondering if the Senate approps might be able to have a brief breakout either now or before we reconvene.
Sure. Why don't we do that now? Does the House want to break out as well?
We might as well.
Might as well. Okay.
So why don't we come back at 1:15 or 1?
Okay. Why don't we do that? Let's come back at 1:15 because we'll be lucky if we can get our shoes tied by 1:15 in or 12:15 in our breakout. So anyway, okay. If anything else before we recess for noon. Anything else? So just hang on for a second. We'll get those. We'll go ahead and recess for noon, and then let's go to our respective breakout sessions here upon